Good morning. Good morning. Just make sure. All right. Good morning. Good morning.
Good morning. Good morning.
We're actually in good shape today. Everything's working. That's a huge stressor when you come in on Monday morning and nothing wants to work, you know. So better day today. So did you guys do your homework reading? Chapter 1 in the yellow book? Not too exciting, right? I know, you just kind of have to get through it. So if you took the book, if you took the test on page 181 of the book, did you grade it using the answer key? Did everybody grade it? Okay. So I'm going to get your scores now. So I'm going to read your name out. When I read your name, if you didn't get to it, just say pass. Okay. If you didn't grade it, just say pass. If you know how many you got wrong, tell me how many you got wrong. If you did the down here, it actually tells you your grade. You know, if you missed one, you got a 95, 2, you got a 90. If you did your grade, you can give me your grade. Okay.
So are we just doing the 1 out of 10?
Just one. Yep, just chapter 1.
No, I'm talking about the questions. 1 out of 10 or like
all 20.
All 20?
All 20. Yep, the whole thing is graded together.
Thank you.
You're welcome. So everybody good? Ready? All right, Jessica.
I got a 95.
Thank you, Gianna. Cheryl.
95.
Thank you, Ashley.
Pass.
Jacqueline.
Pass.
Gabrielle.
Gabriel?
Gabriel, sorry. Kayla. Lindy. Paula. Dwayne. Faith. That's fine. Roque.
90.
Griselda. Lewis.
95.
Rebecca. Okay. All right. Those of you who took the test and graded it, do you have any questions on what you missed? Do you know why you missed the one that you missed and where your error was? Is there anything you want me to explain to you? No? Okay. All right. So let's review. Let's see if we remember what we learned on Monday. So how do we know what to do with each patient? The care plan. And we follow the care plan, the whole care plan and? Okay. Half of our job is to observe. And who do we report those observations to? The nurse. Look how good you guys are. I told you you're going to learn all of those things on the back wall. Every skill starts with an opening. What does every opening start with? A knock. It's always about the patient, so we're going to greet them nicely, right? We are going to address them how? By their name. That's right. Remember, for the test, we're not going to use ID bands. We want to address them by name. For the test, everybody will be Mr. or Mrs. Jones. Just one name makes it super easy. How do we have to introduce ourselves? What do they need to know about us?
Who we are.
Yeah, name and
Title.
title. That's right. Don't just walk in and say, hey, I'm Patty. Of course, you're not Patty, so use your name. But all right. So what are we going to describe? Yeah, the skill. Absolutely. So they have to know what we're there to do. Don't just assume that they know. What do you need to get from them? Yeah, permission, consent. Absolutely. Can we just, I mean, they're in our facility. Why can't we just go in and do what we need to do? Yeah, residence rights. It's still their body. That's right. That is correct. We've got to be very careful with that. Once we get all of that out of the way, what are we going to close? The privacy curtain. We're going to talk a little bit more about the privacy curtain today. And then once we've closed that curtain, what do you want to do? Why? Yeah, cooties. Absolutely. Absolutely. I actually drew that little cootie. I thought it was kind of cute. Okay. And then once you have clean hands, you can go get your clean supplies, right? Why can't we get our supplies before we start the skill? Okay, supplies are clean and contamination. That's right. You've got to make sure you have clean hands to get your clean supplies. We're going to talk about that in a few minutes as well. All right, so it's super important. Probably the most important thing on this banner is don't touch the patient until your hands are clean. A lot of things on the opening there. They all count, but the thing that counts the most is, yep, don't touch your patient until your hands are clean. Okay. So that was the skill rules in the opening. Let's move on to the closing. So with the closing, what kind of environment do we need to leave our patient in? Okay, clean, safe, comfortable, sure. My defining characteristic here is always leave your patient looking better than you found them, right? The bed has to be in what position? The lowest position. We're going to talk a little bit more about that too. And I know I didn't cover this too much, but the bed does need to be in the lowest position. What word do they need to hear from us? Are you comfortable? And comfortable is more than just physical comfort. What do we need to offer them? A magazine or something for entertainment, emotional comfort. Yep, TVs. Sure. Yes, absolutely. All of those are perfect. All of those are perfect. For the test, I just had to pick one. I settled on magazine because that's the one that Prometric actually uses in their guidelines for the evaluators. Okay, so since they're mentioning it to the evaluators, I figured it was a good one to go with. Can't go wrong. Good. Now, I do want to mention on this, right? We're not actually passing out magazines in the hospital because that's a germ nightmare. Talk about cooties, right? We're not just going to go pass out magazines in between patients. This is a representative action that just shows that we're going to pay attention to their emotional needs as well as their physical. Good? Okay. Now, comfort is covered in a lot of different ways. Okay. Making sure the environment is clean, making sure the patient doesn't need anything else. I'm actually going to ask, can I get anything else for you? But it also has to do with the head of the bed at the end of the skill. Now, remember, we talked a little bit on Monday about having to put the head of the bed up when we brush teeth. Why? Yeah, you don't want to kill your patient. Good job, right? So at the end of the skill, maybe they want to take a nap and they want the head of the bed down. Well, that's okay as long as care plan doesn't tell us otherwise, right? So at the end of the skill, the head of the bed is always patient comfort. Do they want to be sitting up to watch TV or to do a crossword puzzle or to talk with their family? Do they want to lay back down because their back is hurting? They have a headache or they just want a nap. So whatever they want at the end of the skill is fine for the head of the bed. That falls under that comfort. Okay. We actually don't have to ask about this for the test. I don't have to say, do you want the head of the bed adjusted? I can if I want to. But if the patient mentions it, what do you think I have to do? Address it. Yeah. If the patient says, if I at the closing say, is there anything else I can get for you? And they say, yeah, I want to lay down. I've got to address that. Good. It's all about listening to the patient. Okay. But we don't actually have to ask. So now that we've done our skill, what do we have to open? The curtain. So let me talk about that for just a second, because we kind of ran out of time at the end of Monday's class, and I didn't go over this really well. So in a clinical setting, when we close that curtain for privacy, we're blocking off the patient from outsiders, which is good when we're trying to do a skill, but it's not always good when we leave the patient, because people are kind of social creatures. And if you leave a patient behind a closed privacy curtain for too long, they tend to get depressed. They tend to withdraw. It does affect their psychological well-being. Now, of course, they can ask, leave the curtain closed, I want to take a nap. That's okay. But as a routine action, we're going to open the curtain at the end of every skill. That way the patient has the ability to interact with others. It helps with social isolation. It helps with frame of mind. It helps with a lot of different things. Entertainment too. I mean, there's always something going on in that hallway. Always. All right. So how are they going to let you know that they need you? So we have to put it in or near their hand. But there are two skills that you actually have to put it in their hand, and we'll talk about those as we get there. Okay. All right. And then once you've got all of that stuff done, right? They're in a clean environment, they're safe, they're comfortable, the bed is low, they're covered, all of those things. I don't have covered on there. All of those things. And we've opened the curtain. What's the next action we want to do? Wash our hands, because remember, we've touched that curtain and that call light and the patient, and we don't want to leave that room with soiled hands, so we're going to wash our hands. And that gets rid of all of those patient cooties. Now, once we wash our hands, should we go back to the patient? If we do, what do we have to do again? Okay. Now, once we got all of that done and we're nice and clean, ready to move on with our life, if we have to document, that's when we would be documenting, is after we've washed our hands. Because you don't want to put cooties on this pen that's going to go home with you at the end of the day. But you're touching the documentation sheet that's been touched by people everywhere. Is that clean? So what do you have to do after you document? Wash your hands again. So if you remember, I said everybody's going to get one documentation skill for the test. When you get a documentation skill, you're going to have to wash your hands 3 times for that skill. Good? Questions? Okay, let's talk about hand sanitizer. So, where's my little guy? Good morning. Okay, so with hand sanitizer, you have to use it right. There he is. Okay. With hand sanitizer, you have to use it right. And most people don't. Now, hand sanitizers can be used in a clinical setting, no problem. Isn't he cute? It can be used in a clinical setting. But the problem is that we don't use it properly most of the time. So we have to talk a little bit about hand sanitizer. And interestingly enough, hand sanitizers are actually preferred by the CDC for use in a clinical setting. And that's because how hand sanitizer works and how it's different from hand washing. When I go over to the sink and I wash my hands, all of those germs that are on my hands go down the sink. So I end up with hands that are reasonably reduced in germs. You'll never get 100% of the germs gone because you can't sterilize. You know, that's sterilizing, and you won't tolerate that. We always have a certain amount of bacteria on our skin that's actually helpful bacteria. Okay. But we're getting rid of most of the bad stuff. Good. So hand sanitizer works a little bit differently. When you use hand sanitizer, it doesn't get rid of the pathogens. They don't go down a sink. They don't pop into the atmosphere. What it does is every pathogen is covered by a membrane or a protein shell, and the hand sanitizer actually breaks that down. So even though we may not be getting rid of the pathogens, they're not going down a sink, we are making them all ineffective. Good? Makes sense? Okay. So because of that, we generally tend to use hand sanitizers in a clinical setting. The problem is that most people don't use them right. In order to be effective, you've got to use more than you think you do. Like most of us get just a little bit, like something like this. That's actually not enough because I have to use enough to keep my hands wet for at least 20 seconds. Where did we hear that before?
Washing your hands.
Yeah, so it's the same amount of time. A lot of us use hand sanitizer as a time saver. A little dab, rub your hands together, you're done, and you did not kill all of the pathogens. That's a problem. We'll talk a little bit more about the immune system later. So when you're using hand sanitizer, you've got to get more than you think you need. You're going to bring your hands together and rub them. Now, you have to rub all those same surfaces, right? The tops of the wrists, the backs of the hands, in between your fingers, in between your thumb and index finger, the bottom of your hand by your pinky, and in between your hands for at least 20 seconds. So you're doing the same actions, just not over the sink. And that's not normally how we use hand sanitizer, is it? No, just a little dab, rub your hands together, and you're done. Well, that leaves pathogens on the bottom of your hand, up around your wrist, in between your fingers. We want to make sure that we're getting all of those surfaces really, really well. Good? Make sense? Okay, this is the biggie though. Hand sanitizer does not work on two very specific pathogens, C. diff and norovirus. Norovirus is called the daycare disease. It's also called the cruise ship disease because when you have a group of people in close contact, it will spread like wildfire. All it takes is one to make an entire cruise ship very sick. And it happens at least once a year. So the problem with norovirus is that it's not affected by hand sanitizer. Its protein shell, super strong. It laughs at this stuff. And norovirus, guys, you don't want. It is nasty. This is the stuff that makes everything come out of both ends for 2 days. You guys have everybody had that, right? Both ends, 2 days. Yeah, that's norovirus. Now, if you think norovirus is bad, let me introduce you to its big brother, C. diff. C. diff will make everything run out of the back end for at least 6 weeks. Yes, and it is very painful. It has a lot of abdominal pain that goes along with it. It is really nasty, horrible stuff. And if you have a patient with C. diff, hand sanitizer does not work. So if you're working with C. diff patients, and almost every facility has at least one C. diff patient on board, if you're working with C. diff, you've got to make sure you're washing your hands religiously. Good? So 2 things that hand sanitizer does not work on. Norovirus, particularly important if you're going to work with pediatrics, and C. diff. That might be a written test question. You might need to know that. Okay. We also should not use hand sanitizer if our hands are visibly soiled. If I've got feces on my hands, hand sanitizer isn't going to do a whole lot for that. If I've got blood on my hands, hand sanitizer isn't going to do a whole lot. You need to go to the sink and wash all that stuff off. Good. So we don't use hand sanitizer when our hands are visibly soiled. And we really shouldn't use it before we eat, drink, smoke, or bring our hands up to our face for any reason. Remember, I said that these pathogens don't pop into the atmosphere, right? They're still on your hands. Yeah, they're inactive. I don't know about you, though. I don't want to eat a tuna salad sandwich with a side of E. coli, even if the E. coli is dead. Just not very appetizing, right? So it's better to go wash your hands if you're going to put your hands anywhere near your face. That gets all the germs down the drain. So good? Understand about hand sanitizer? Okay, I want to respond to Jorge real quick. Jorge sent a good morning comment, but he put a comment on, Jorge actually came in second on our game show last week. But he put a comment on one of my videos asking, can you wear a scrub cap to the test? So I want to go over dress code for the test real quick. So during the state exam, you don't have to wear scrubs. You should, but you don't have to. You can also wear scrub caps. You do not need to take a stethoscope or a blood pressure cuff or anything like that to make you look more of the part. Whatever you choose to wear is fine as long as you have closed-toed shoes. I personally wouldn't go overboard. I wouldn't wear a scrub cap or anything like that because you may be kneeling on the floor to do foot care. You don't want that thing to fall off and become a hazard, right? Because now it's an infection control issue. What are you touching? So I would just try to keep it minimized, right? Wear only what you need to wear. Don't make yourself look more nursey than you need to. Okay. You also don't need to take a blood pressure cuff or stethoscope with you. We're going to talk about that. Blood pressure is not tested on the state exam. You will not have to demonstrate blood pressure. So no need for a stethoscope or a blood pressure cuff. We'll be talking about that more on Monday because we go over blood pressure on Monday. You will need to bring your blood pressure cuffs and stethoscopes with you on Monday. So you've mastered these three principles. So 3 down, 8 to go. And we're going to go through several of those today. Okay, so a lot of learning to go. Everybody good? Settled in? All right, let's go to page 52. See, now I've got the right graphics and the right pages. I'm psyched. Okay, so when you're looking at page 52, this is for those of you playing along at home. This is what the page looks like. And if you're playing along at home and you don't have the book, you probably need to go order the book. It's on courses.foryourcna.com/shop. And you can order this book. So this page, we're going to have a page like this for every single skill that we learn. Okay. We have along the side the principles that are going to govern that skill. Well, we know that every skill in the world starts out with a care plan. We're always going to do the opening. We're going to evaluate glove rules, which we're about to get to, and we're going to do the closing. So these 4 are always on every single skill. And some skills are going to have a few more that we have to learn along the way. So this particular skill, the only new principle that we have to learn is glove rules. And that's where we're going to start this morning, is learning a little bit about gloves. Now on this page, you'll also see each one of those banners with all of the principles. So it's easy for you to review. You've got a short version of the skill up here. Think of it like Cliff Notes. And then there's a video that goes along with this. So I actually have a demonstration video for you to be able to watch if you need to. I'm going to demonstrate it as well. Along the bottom here are test specific information. So somebody with your level of experience, which is none, should be able to complete this skill in how much time? 5 minutes. Yeah, we're counting a pulse for 1 minute.
Sorry.
And they're giving you 5 minutes to do that. Don't rush. You've got all the time in the world. Okay, good. All right. So we already know skill rules. You proved it to me because you just recited it. We already know the opening. You proved that to me as well. And we know the closing. So those 3 principles we've already mastered. We're going to move on to learn now about glove rules. So this is on page 40 in your skills book. And for the next 45 minutes, I'm going to be explaining to you all about gloves. And then we're going to come back to pulse, and I'm going to show you how to take a pulse in a few minutes. Okay? So gloves have to be evaluated for all skills. It's one of the big 4. We call it the big 4 because they show up in every single skill. Skill rules, opening, glove rules, and closing. Every skill never changes. Okay? So every single skill. Now we've got 4 specific steps here that we have to learn. And in order to learn them, I've got to explain them one by one. So remember that these 4, the big 4, apply to all skills that we learn. So if you want to follow along, you don't need to take notes. I've already done that for you. The notes in this case are going to be found on page 41. But reading is boring. I'd rather do something a little more fun. So in order to explain glove rules, we're going to build a sandwich. Hypothetically, I don't have the stuff here to build. I'm going to walk you through it, okay? Because when you have somebody build you a sandwich, what do they wear? Why? Why do you? Now, you probably feel pretty good that they're wearing gloves, don't you? You would not want them to make your sandwich without gloves. We kind of think that that's really scary because what would they put on your sandwich, right? What kind of germs would you get? So you're pretty happy that they wear gloves. Good? Okay. So in order to build a sandwich, the first thing I'm going to do is put on a pair of gloves. And then I'm going to ask, what kind of bread would you like? White. So I'm going to go over to the bread cart and grab a loaf of white bread. I'm going to bring it back to the counter, pick up the knife that's laying there, and slice that bread open and fold it, kind of push it down so I can get to the inside. I'm going to put that knife back on the side. So do we want some mayo on this? All right, so I'm going to reach in and grab that. There's always like a long spatula there in the mayo. So I'm going to reach up, grab that spatula and spread the mayo onto the bread and put that spatula back in. What about some other sauces? Do we want any other sauces? Maybe honey mustard or something? Yeah. Okay. So I'm going to grab the bottle of honey mustard and tap it on that counter and spread it on the bread and put it back. Yeah, that looks good. How about some bacon? Bacon's always better on a sandwich, right? So I'm going to get into the cooler, grab the package of bacon, get into the bacon package and get a couple slices and put them on our sandwich. So far, I'm getting hungry. You guys getting hungry? Sounds like a good sandwich. All right, what kind of meat do we want? Ham, turkey, roast beef? Ham. So I'm going to open up that cooler, get the ham out, close the cooler, and put the ham on the sandwich. And now we need some cheese. So I'm going to go over to the cheese cooler. And what kind of cheese do we want?
American cheese.
American cheese, white or yellow? Yellow. Okay, so I go into that cheese drawer and I'm out of yellow American. It's pretty popular. So I need to get into the walk-in cooler. So I'm going to open up the walk-in cooler, walk in, pick up the container, open the lid, Get the cheese out, close it, but you know what? It's a block of cheese. I actually am going to need to slice this. So I'm going to put it on the slicer and slice a whole bunch of the cheese. Do we want this toasted?
Of course.
Oh, good job. All right. So we're going to have to wait for a minute because the toaster is busy. So I'm just going to kind of stand there for a few seconds. Toaster is available. So I'm going to use that paddle to put the sandwich in the toaster oven. And then I have to use the controls, to punch in the time. And we're going to sit here and wait for 30 seconds until the toaster is done. And then once it's done, we're going to use a paddle to pull the sandwich out. And we're going to put it on the counter. How about some lettuce? Lettuce. So I'm going to reach into the big bin of lettuce and grab a handful and spread it out on the sandwich. What about tomato? Okay, I'm going to reach in and pick up the tomato. And I think I'm going to cut that tomato in half so it's not so big. So I'll pick up that knife. We're going to cut that piece of tomato in half, put the knife down, and put the tomato on there. Any other toppings?
Some pickles.
Pickles, garlic pickles?
Sure.
Okay, so I'm going to reach in the garlic pickles and squeeze those out and put some of those on. Do we want olives or banana peppers? Banana peppers. So I'm going to reach in and grab some of those and spread those out. How about some onion or green pepper? So I'm going to reach in and grab a little onion, grab a little green pepper and put that on there. How about oil, vinegar,
Sure.
salt, pepper?
Yeah.
So I'm going to pick up the oil and the vinegar and the salt and pepper. And then I'm going to pick up that knife again. And I'm going to shove that knife in there and fold that bread over and pull the knife out and use the knife to cut that sandwich. And then I'll wrap each part up in paper and put that into a bag and go over and type it in to the interface so that I get the ability to charge you for that sandwich. Anybody hungry?
Not anymore.
So
Not anymore.
are you ready to eat that sandwich? I probably just turned your world upside down.
Yeah, that was crazy.
Because you thought those gloves were keeping your sandwich safe. Did those gloves really do what you thought they were going to do?
Ignorance is bliss.
Oh, it is, isn't it? Yeah, and that's the problem here, guys. And that's what we're going to talk about today, right? When you wear gloves routinely, you stop paying attention to what you're touching with those gloves. And that's a problem. Now, guys, the sandwich was good. This was a real sandwich that I really had built, and I took a picture of every step. And yes, I ate the sandwich, and it was good. And the reason I can eat this sandwich and be perfectly okay with it is because I've got a healthy immune system. And my immune system needs to work out a little bit now and then to stay healthy, right? If my immune system sits on the couch all day, every day, it's going to get flabby and it's not going to work very well when I need it to. So a little bit of exposure is actually a good thing. That's not the problem here. The problem is your perception of what those gloves are doing and how that can affect our patients down the road. And that's what we're going to talk about here. So let's really quickly recap all of the things those gloves touched. Well, they touched the bread cart. They touched the knife. They touched the mayonnaise spreader, the sauce bottles, the outside of the bacon package, the cheese drawer, the outside or the door handle, the outside of the cooler, the containers inside of the cooler, the slicing machine, the table, the toaster oven controls, the paddle, the lettuce, tomatoes, and other toppings, and the wrapper. So there's a lot of things that these gloves touched, right? And we probably weren't aware of it 5 minutes ago. So what changed? Everything now, because you're aware of it. Okay. So in order to determine whether these gloves are effective, you actually have to stop and think, who are those gloves there to protect? Now, you thought they were there to protect your sandwich. That was your thought process, right? But is it possible those gloves are there to protect the worker? It's possible. In reality, it's probably a little bit of both. So if it's a little bit of both, we've got to think about this a little bit more critically. Okay. So let's learn about the chain of infection. So this is going to be located on page 123. Remember, I said you never have to take notes here. I've done that for you. One 123 shows you this picture of the chain of infection. And this is what it looks like in a bigger version. So we're going to look at each part of this chain of infection to figure out why we thought gloves were a good idea and why we still think gloves in a healthcare setting are a good idea. Because just like those gloves for the sandwich, you've got some misconceptions that I need to break down in order to build up healthy ones. Okay? So the first stage in the chain of infection is a pathogen, because in reality, no pathogen, no problem, right? You can't pass on something you don't have. I don't have HIV, therefore I can't give it to you, right? No pathogen, no problem. In an ideal world, we would have no pathogens anywhere and everybody would live long, healthy lives, but we don't live there. We have pathogens. So if we have pathogens, the next stage is that they have to have somewhere to live. Pathogens don't live out in the open. They don't do very good homeless. They are kind of soft guys. They like, soft music, comfy houses, they're not built for the outdoor life. So they need a nice warm place to live, or a home, and we call that a host. So now if I have HIV and it's living inside me, I am a host. Okay, good. I still can't pass it on yet. And that's because pathogens that are living inside are comfortable. Remember, they don't do well out here. So they're comfortable inside. It's a home, not a prison. They're not trying to escape. So if I have HIV inside me, it's going to tend to stay inside me. It's a home, not a prison. And pathogens, just like everybody else, when it's time for you to leave, how are you getting out of this room? Through the door, right? You're not going to break down the wall, are you? You're going to break the window to get out? You're probably going to take the easiest opportunity, the door. That's what it's there for. Yeah, or the back door, sure. But we generally don't tend to break walls down to get out, do we? We go through a portal that's already there for that purpose. So we need to understand that pathogens are just like us. When they're inside a host and they're warm and comfortable, they're not trying to break out. They have to find a door, just like you find a door. Okay, good. Now that door out is called a portal of exit. Now the thing about pathogens, remember I said that they kind of like, they're kind of soft, right? They like to stay in their home. So usually with pathogens, they don't leave willingly. Like we can leave a door open, and unless we kind of force them out, they're probably going to stay where they are. It's warm, it's comfy here, I like it. So a lot of times pathogens have to be forced out. Anybody ever sneeze? Yeah, that is your body's way of forcing a pathogen out a door. What about coughing? It's your body's way of forcing a pathogen out of a door. Bleeding, your body's way of forcing the pathogen out of the cut. Right? So most pathogens, they have to leave by force. Good? You with me so far? Just because a pathogen gets outside of the body, though, it's not really a fun time for them. So pathogens leave the body through wet body openings: eyes, nose, mouth, genitals, rectal area, wounds, rashes, sores, and incisions. This is how pathogens leave the body. They can't burrow through the skin. They're not breaking the walls. They have to leave through a doorway. Good? Good? All right. Remember, I said they don't live very well out here. Remember that. The other problem with pathogens is that they don't have wings or feet. They have no way of getting around on their own. They're kind of like an infant. They got to be carried. So they usually have to flow in something liquid or float on particles in the air. But they can't get around on their own. You're starting to see it's kind of hard to get an infection, right? You got a pathogen warm and safe in somebody's body. They got to be forced out. And then they got to hitch a ride. And even if they hitch a ride, either in blood or on air currents, that alone isn't enough to make you sick. Those pathogens have to be able to get inside another host. Good? They don't break down walls. They're not going through your skin. So how this pathogen gets around, either in body fluids or on air currents, is called its mode of transmission. And this is kind of important because pathogens don't always spread the same way. Like if I have HIV inside of me and I sneeze, well, HIV isn't coming out because it's not coming from that place, right? HIV isn't in my lungs. So if I have HIV and have hay fever and start sneezing, you're not in any danger. HIV lives in my blood. So you would have to come into contact with my blood for you to be in danger. Now, COVID, however, COVID doesn't live really well in the blood. It likes to camp out in the lungs. So if you have COVID and sneeze, well, that is evicting some of the pathogens. So do you understand that different pathogens are going to exit the body in different ways? How it gets around is called its mode of transmission. And this is how, as healthcare workers, we know what precautions to take. So if I've got a patient with COVID, I want to make sure that their secretions aren't getting in any of my holes. So I'd want to put a mask on and cover my face with a shield so that if they sneeze or cough, those pathogens on the particles in the air don't come into any of my portals of entry. Good? Okay. I don't need a mask and shield if I'm working with an HIV patient because that's not how HIV travels. Good. Now, the good thing as a CNA is that you don't need to know what pathogen needs what protection. What do you think you're going to have access to that's going to tell you that? The care plan. So we have a pathogen that has escaped or been forced out of our patient, and it has traveled either in body fluids or on particles in the air, and it lands on us. Well, as long as it's landing on skin, it's not really much of an issue because it can't burrow in. It can't break down the walls. Remember, they're kind of soft guys. They have to look for a doorway in. So just like we had doorways out of our patient, a pathogen needs a doorway in for you. And remember, a doorway is any wet body opening. So eyes, nose, mouth, genitals, anal area, wounds, rashes, sores, and incisions. If you have any of those that a pathogen can get into, well, now you're one step closer to becoming infected. But don't panic, because just because a pathogen got in doesn't necessarily mean that you are going to be infected, because you have to be susceptible. If my white blood cells have been trained on how to kill that pathogen, they're going to get right to work. They went through basic training. They know all about this. They've got it down. Okay, they're going to go right to work, and chances are my body is not going to be a good host. My white blood cells will take care of it. I have to be susceptible to become infected. This is where your immunizations come in. Guys, an immunization is nothing more than boot camp for your white blood cells. It literally says, hey, white blood cell, this is the bad guy. This is what it looks like, and this is how we kill it. So can you look this over for me? Get really familiar with it. And that way, if you see this guy, you know exactly how to kill him before he's able to multiply. That's all an immunization is. It is boot camp for your white blood cells. So if you're up to date on your immunizations, if you've had your hepatitis B vaccinations, and hepatitis B flows out of your patient, travels to you, you get it on your hand and rub your eye, and now hepatitis B is in your body. Well, you've been vaccinated against it, so your immune system says, hey, no sweat, I got this. Kills hepatitis B, and you don't get infected. Good? Makes sense? So having a healthy immune system makes sure that your white blood cells can respond to any threat that invades. So you want to make sure that you are in tip-top shape. Remember, we're working in a place that has a lot of pathogens. So you want your immune system in good shape. You want to make sure you're well rested, you're eating properly, you're getting good exercise. And exercise plays a huge part in this, guys, because white blood cells are made in your bone marrow, and they have to be replenished all the time. You don't get one set for life, right? They have to be replenished all the time. Well, in order for your bone marrow to make those white blood cells, it has to be stimulated with exercise. So getting a good 15, 20 minutes of exercise every day keeps your immune system in tip-top shape. So does getting adequate rest, making sure you have good nutrition level at a moderate level. All of those things will help you not be susceptible in case we have an invader. Remember that pathogens need a home to survive, so they're not going to live for very long on surfaces outside of the body. But we do want to make sure that we maintain a clean environment. So we're not going to go out of our way to contaminate everything in the environment. We're going to be careful about what we're touching when we have gloves on. But remember that most pathogens don't survive outside the body for very long. Some are as short as 2 minutes, others as long as 24 hours. But the moral of the story is they really need a home to live in. Okay. Remember that pathogens usually travel in fluids, so as long as you're not touching body fluids, you're not at increased risk. These pathogens cannot penetrate your skin. I remember when I was a little kid, I used to think they could. I used to think if you got cooties on you, they could go right through your skin and get into you. It actually doesn't work like that. Pathogens have to work pretty hard to get inside. Now, they want to get inside. They're motivated to get inside. But they got to work pretty hard. But even if you do touch body fluids, as long as those pathogens don't get into any of your doorways, you're pretty safe. If you remember me saying just a few minutes ago that you probably don't want to use hand sanitizer when you're putting your hands up near your face, like for eating, drinking, smoking, that's because most of our wet body openings are right here. Right here. So you don't want to eat unless you have clean hands, because you're bringing pathogens right into a portal of entry. And we put our hands up near our face way more often than you think you do. It's very, very common to, push hair out of your mouth, put your hand like this, talk on the phone, rub your eyes, because allergies are crazy out there right now. So there's a lot of opportunities for you to bring pathogens to these areas. You want to try to be aware of that and try to wash your hands, get those pathogens off your hands before you bring your hands up. Okay. So they have to work pretty hard. It's only when we have a pathogen that leaves a host through a doorway, usually under force, and travels in fluid or particles on air currents, and finds a wet body opening to invade, and the person is susceptible, that infection can occur. That's a whole lot of ands. Good? So when it comes to preventing the spread of infection, don't let stuff from other people's holes into any of yours. There you go. Cover your holes. Okay? You want to keep stuff from other people's holes from coming into yours. Make of that what you will. Okay? So gloves help by providing an extra layer. Okay? So right now, I look pretty good, right? I don't have any visible openings on my skin, but I actually have this little hangnail here, and it was bleeding this morning. So what does that tell me? What do I have? I have an opening. That's right. So a lot of times we have very small body openings that we may not be aware of. So if I'm working with body fluids, if I know I'm going to be around something wet and sticky that's not mine, I'm probably going to put an extra layer on just to make it a little harder for those pesky pathogens, right? Want to give them something to block their path. So gloves are appropriate if we're going to be touching body fluids. And here's the thing. This is any body fluid. Even if I know the body the fluid came out of, you probably want some gloves on. You can't tell by looking at somebody what kind of pathogens they have. We don't have little neon signs on our, man, that would make life so much easier. If you had a neon sign on your forehead that told me everything that was wrong with you, I could just do a systems check. There it is. Got it. We don't have that. You can't tell by looking at somebody what they have, right? You may have hepatitis C and you may not even know it because you're not sick yet. There's no system check that we can run. So until you start getting sick and you start getting symptoms, and then you're going to put those symptoms off for a while, seeing if they go away. And eventually you'll probably make your way to the doctor who's going to order some lab work, and then you'll go get lab work. And it could be 6 months before you realize that you are infected with a pathogen. And yet you have been spreading that pathogen to everybody that you've had access to holes. Got it? You can't tell by looking at somebody. So we're going to use this with everybody. Everybody. That is called standard precautions because it's a precaution we're going to take all the time with everybody. It's standard. Good? Questions? But let's think about who actually needs those gloves, right? I'm going to put gloves on because I got this little cut here and I don't want anything that this patient's got to come into my body. That's a good idea. But let's think about who actually is at risk here, right? Remember, I'm pretty healthy. My immune system's currently on standby. Doesn't have a whole lot to do. Just kind of waiting for me to go get a sandwich. But my immune system's pretty unbusy at the moment, but that's not the situation for my patient. My patient's immune system currently occupied with whatever it is that they're here with, an illness, an injury, but their immune system pretty busy. Now, we have to remember that our patients are in a place with a lot of pathogens. They're fighting one right now in their body, but they're in a place where there's a whole variety, like a buffet of pathogens. Pick and choose what you want. Now, what do you think is going to happen if we, as healthcare workers, bring pathogens into a portal of entry on a patient who is already fighting something else off? That's right. Who's going to fight the new invaders? Your army's already busy. So who do you really think needs gloves in a clinical setting, you or the patient? Yeah. So this is where we kind of get messed up in our minds. We think I need to wear gloves for everything because I don't want what they have. And that is a very valid point. But the problem is when you start wearing gloves routinely all the time, you stop paying attention to what those gloves are touching, just like the sandwich people. They have no idea that they are contaminating your sandwich from one end to the other. The rule is you wear gloves when you make a sandwich. They're wearing gloves when they made a sandwich. What's the problem? And we do this in healthcare as well. We walk into a patient's room, we put the gloves on, we introduce ourselves, we pull the privacy curtain, we go get our supplies, we do everything we need to do, and every step of that is contaminating our gloves. Who's the one at risk here? The patient. Remember, those pathogens have to have a doorway in, a wet body opening. You guys remember that? That's what we do. We are around wet body openings all the time. We do mouth care. We feed patients. We bathe patients and groom them. We help with toileting. We are around almost every one of your patients' holes all the time. Most of the skills that we do are going to revolve in some way around one of our patients' holes. So if we contaminate those gloves and we bring that contamination right up to one of their doorways and their immune system is busy, what could happen to this patient? Say it louder. They could die. Absolutely. This is real. You go into the hospital, you have a greater chance of dying from this than whatever brought you into the hospital. That's why this lecture is so important. Good. Did I challenge the way that you think about gloves a little bit? I'm not done. So remember, a doorway out can also be a doorway in. So if we're working around the patient's eyes, make sure you have clean gloves. Nose, mouth, make sure you have clean gloves. Genital area, make sure you have clean gloves. Anal area, wounds, rashes, sores, incisions, make sure your gloves are clean. Remember that our patient may not have the ability to fight an infection that we bring on board. So gloves do provide an extra layer of protection for us, but they also provide one for the patient. They're supposed to keep us from introducing extra pathogens to the patient, but only if you use them properly. So if we need an extra layer, like if we're going to touch body fluids, if we're going to touch personal skin, this is skin normally covered by a bathing suit. So breast area on females, genital area on both sexes. or if I'm going to be touching any non-intact skin, wounds, rashes, sores, or incisions, then I'm going to wear a set of gloves. That's to keep both me, because the patient might eject something, and the patient, because I may bring something to the patient, safe. Okay, so remember, those gloves are not just there to protect you. You've got a better immune system than your patient does. We're going to use them, but we need to adjust our thinking. We got to keep them clean for our patient. But they only work if you use them correctly. So our rule here is that the first thing your gloves should touch is the patient, not the curtain, not the call light, not the bed controls, not the sheets, not the toothbrush, not the toothpaste. The first thing your gloves should touch is the patient. That keeps your gloves clean for that patient. You're not introducing pathogens to them. Good? Super, super important. You're going to mess this up 10 ways before this class is over, because it's counterintuitive. You're going to want to go wash your hands, go get some gloves, and do everything from there. Everything that you touch with those gloves is going to contaminate those gloves. I've got to break those habits and build some new ones. So this is going to take some work on our part, and I'll help you through it. So once we've worn our gloves and we've done what we needed to do with our patient, now we got to pay attention, because our gloves have pathogens on them. You don't want to spread that all around the environment. Yes, I know pathogens don't live outside the body for too long, but they do for a little while. We don't want to contaminate everything in our patient's room with soiled gloves. And I see this all the time in healthcare. It just makes me shudder. A nurse will walk in the room. As soon as she walks in, she puts her gloves on. And then she'll empty the catheter bag and dump that and rinse the container and put it away. Then she'll pour a patient a cup of water and hand it to them, and open the curtain with those gloves and arrange the sheet, and then take the gloves off before she leaves the room. I see it all the time. Because when you wear gloves routinely, you stop paying attention to what you touch with those gloves, just like that sandwich worker. That's not the nurse's fault. She didn't listen to this lecture. She probably should. You will have better training than that. You're going to start thinking about the things that you're touching, so you're not contaminating that environment. Would you want to drink out of that cup? No. So once we are done with our gloves and it's time to take them off, once we're done with those gloves and it's time to take them off, we have to know how to remove them properly. There's not enough there.
Do you need gloves?
I got some here.
Do you have gloves? That's funny.
I have lots of gloves next door. I just don't have them in here. Okay, these are small. Some of you are going to have to work a little bit harder to get these on. So, oh, is that? Can you hand one of those over to her, please? Okay, so we are all going to learn how to remove gloves correctly, because wearing them doesn't do you any good if you don't take them off properly. So those of you at home, if you happen to have gloves laying around, go get a set. Small. Yeah, some of you are going to have to struggle a little bit getting these on. All right. So I'm getting ready to do a skill. I've done my opening. I read my care plan. I've done my opening. Knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm here to do whatever skill. Is that okay? Wow, these are small. Is that okay? Patient says yes. I go close the curtain, wash my hands, come back, get my supplies, do my skill, right? So I put I know these are really small. Do your best. So, in fact, I'm going to get a
It's a little snug.
little bit. We're going to talk about that actually in a few minutes.
You said you had extra gloves in your closet.
Next door. I'll go get the other gloves on break. Okay. So I put my gloves on. I've done my skill. I'm ready to take them off. Just watch. Okay, so dirty glove can touch dirty glove all day long. This is fine. There's no problem here. But I do not want dirty glove to touch skin. And the way that we remove the gloves is going to affect how much cross-contamination we end up with. Remember, there's pathogens on here. That's the whole reason I wore them. So in order to take these gloves off, I don't want to go underneath because glove cannot touch skin. What I want to do is pinch up at the cuff like this. So make sure that your glove doesn't touch your skin. You want to pinch up at the cuff here and pull this off inside out and ball it up in this glove. You want control over this. You don't want it waving around, spreading pathogens everywhere. Now, skin can touch skin, but skin cannot touch dirty glove. So don't put your thumb here to pull this off. You want to go underneath like this. So you're not going to touch the outside of the glove, only the inside. So we have one inside out glove inside the other inside out glove. Okay. Now you can take those home and clean your toilet. All right. Good? Glove removal takes a little practice. Is anybody in here allergic to latex? Okay. Make sure that when you're practicing, you're only using green gloves. Okay. Don't use the flesh colored ones because those are latex. Okay. So the next thing that we need to understand when it comes to gloves is that they're not the magic suit of armor you think they are. We're going to use them when it's necessary. If we're going to be touching blood or body fluids, if we're going to be touching personal skin or non-intact skin, I'm going to get an extra layer. That's good. But we need to have very clear understanding of what those gloves are and are not doing for us. They're providing an extra layer of protection. It is not a suit of armor. Gloves have holes. The more the gloves stretch, the bigger the holes get. So you want to make sure that you're wearing gloves that fit appropriately. Stretching gloves that much, yeah. They have shown, I did a ton of research on this, guys, over the last week. They have done multiple studies, a whole lot of new studies that I had not seen yet on the effectiveness of latex gloves versus vinyl versus nitrile. So in a lot of settings now, we have moved to vinyl gloves or nitrile gloves because a lot of people have latex allergies. And the more exposure you have to latex, the more likely you are to develop a latex allergy or sensitivity. So a lot of facilities now are using non-latex gloves, but they actually have a higher failure rate. So you need to be aware of that. Chemicals affect non-latex gloves more than they affect latex. And that can actually affect the integrity of the gloves. There's a lot of things. You'd be surprised. There's a lot of things that affect the integrity of these gloves. And they've done a lot of studies where they had people wash their hands, they cultured their hands, put gloves on, did a task, took the gloves off, cultured the hands again. And about 60% of the time. Now, a lot of factors go into this, okay? The type of glove, the length of time, there's a lot of factors here, but about 60% of the time, things get cultured from inside of the glove. So you need to understand that if you're wearing gloves, it's a good extra step, but it's not protecting you 100% the way you think it is. Okay? Now, have you ever worn gloves?
Yeah.
What does it make your hands do?
Sweat.
So you end up with, inside the glove, warm, dark, moist. What do we know about warm, dark, and moist? Yeah, pathogens can grow, and you have just created that environment on your hands. Now, 60% of the time, pathogens get through, and you have the ideal breeding environment on your hands. So when you take those gloves off, you probably think that you are safe and clean, and it's probably further from the truth. You guys ever go to a big box store like the one that I don't like saying names because we're on national? Go to a big box store. You ever see back when they had cashiers, now they want us all to do that. But when they had cashiers, the little old lady cashiers that would have gloves on as they were scanning all your stuff, right? And usually they work a 4-hour shift. They've got those gloves on. Their hands are all sweaty. They scan because they don't want to touch your ketchup bottle. Who knows what it's got on it? They scan. And then after 4 hours, they go on break. They take their gloves off and they throw them away and sit down and eat that tuna salad sandwich with a side of E. coli because things got through those gloves. It sat on the surface of the skin for 4 hours, ideal breeding environment, proliferated, but they think that they're clean. It actually would have been better for them not to wear gloves at all and to wash their hands before they ate. Right? Because then they're not creating that ideal breeding environment on their hands. Oh, that would help too. It's grainy. Yeah. Well, you know why they do that? Gloves generally have an odor to them, and they put the silicone inside to irritate your skin because we're trying to get you to wash your hands. Yeah. Because people have this misconception about gloves. They think if they wear them, they can take them off and they don't have to wash. And actually, it's probably more important that you wash after gloves because of the environment. Good? Make sense? Am I blowing your mind? All right. So pathogens got through your glove and onto your hand and multiplied, what do you think you need to do after you remove your gloves? Now, this does not mean that we have to remove our gloves and race to the sink to wash our hands. Remember that whatever pathogens are on my hands are pathogens I got from this patient. They're cooties. So I'm going to finish my work with the patient and then wash my hands. Okay. You don't have to wash immediately after removing your gloves. You can finish working with the patient. Now, if your hands are visibly soiled, that's different. But we do want to wash before we leave the patient. Cooties. Good? Now, if you want to go to the sink and wash your hands after removing gloves, knock yourself out. There's no penalty for that. But it just adds an extra step into the skill that's not necessary. All right, so page 43 talks about glove removal. We've already done that, but here's your step-by-step instructions if you want to go back and review it. So page 43 of the book talks about glove removal. And I've got a picture here that shows pinching up of the cuff. So to recap here, our glove rules are, we're going to use gloves when we might touch body fluids, personal skin, or non-intact skin. The first thing our gloves should touch is the patient. What have your dirty gloves touched? So pay attention to what you're contaminating. And we have to remove those gloves correctly to prevent cross-contamination. So when we see glove rules, these 4 steps are going to be implied. Good. We're going to talk a lot about gloves as we move forward. This isn't the last time you're going to hear it, but this is the foundation that we're going to be building on. Good. All right. So go to page 52, and we're going to learn our very first skill, pulse. So on page 52, here on the side, you can see the principles that are going to govern this particular skill. We're going to read the care plan. We're going to do our opening. We're going to evaluate if we need gloves for this patient. We're going to follow these steps, which we're going to get to in a second, and we're going to do the closing. Okay? You guys see how this works? These steps. We always evaluate glove use for every skill. It's not based on the skill, it's based on the patient. So let me give you an example. Let's say I'm going to take your pulse. I'm not touching any personal skin, right? Your wrists aren't covered by a bathing suit. You have no open areas on your body, that I'm going to be touching. And there's no blood or body fluids in the area. So I went through my 3 checklist steps. The answers are all no. So I don't need gloves. I'm going to wash my hands before. I'm going to wash my hands after. Good. Now I have to take your pulse, and you just had carpal tunnel surgery. And I have to take the pulse on that side because the nurse is trying to find out whether collateral circulation was reestablished. So I'm going to be near an incision while taking your pulse. Do I need gloves? Okay. So any skill that we do, we have to ask ourselves these 3 questions. The first question is, during this skill on this patient, is it possible that I could come into contact with body fluids? If the answer is no, we're going to move on to question 2. If the answer is yes, I need gloves, I can stop there. If the answer is maybe, I need gloves. Okay. So question number 2. Is it possible doing this skill on this patient that I might come into contact with personal skin? If the answer is no, I'm going to move on. If the answer is yes, I can stop, I need gloves. If the answer is maybe, I need gloves. Question number 3, am I going to touch any non-intact skin on this patient doing this skill? If the answer is no, I don't need gloves. If the answer is yes, I need gloves. If the answer is maybe, I need gloves. Good. So the only way we can get away with not wearing gloves if the answer is definitively no on each one of those steps. Good. Do you guys remember I said the more contact you have with latex, the more likely you are to develop a latex allergy or sensitivity? Guys, that's not just you. We're using these gloves on who? The patient. That's right. So we have to be aware that by wearing gloves all the time, we're actually, especially when we don't need them, we're actually increasing the risk of our patient developing a sensitivity as well. Good. So when I first became a nurse a million years ago, we didn't wear gloves. In fact, there was one box of gloves in the supply room that was only used when you were assisting a physician with a bedside procedure. And, we knew we were going to get all elbow deep in something. Other than that, we didn't use gloves. Now, when the AIDS epidemic happened in the late 80s, we didn't really know what to think. We didn't know how it spread at first. We didn't know how much of a risk we were at. And that's when gloves actually became more mainstream. And everybody started using gloves for everything. Well, we know what happens when you wear gloves for everything. You stop paying attention. And now we're starting to realize that probably wasn't the right solution to this problem. Much better to educate our staff members and get them to make better choices rather than just wearing gloves for everything. Okay?
That time period is crazy. Actually,
It
pretty
was.
recent.
Yeah, it was. It was. One of my very first jobs as a nurse was taking care of HIV patients in a community setting because nobody else wanted to. Yeah, everybody was afraid.
Yeah.
And, you know, I mean, the fear is real. We're afraid of what we don't understand. And it takes us some time to figure it out, right? When, you know, new diseases don't come with an instruction manual. So we tend to put very restrictive processes in place and then back them up as we learn something. Does that make sense? Does that sound familiar at all?
Magic Johnson.
Yeah.
Yeah, teammates didn't want to touch him or play with him.
Sure, absolutely, because they were afraid. Absolutely. But we just had this with COVID too. We put very restrictive measures in place because we did not know exactly how it spread. And once we got familiar with it and we did our research, then we started backing up the recommendations. Right? Does that make sense? Okay. So let's talk about what a pulse is. So you have a heart in the middle of your chest on the left side. That heart squeezes. When that heart squeezes, it pushes out a wave of blood. That wave is going to push the one in front of it, and that one will push the one in front of it, and that one will push the one in front of it. And this is how blood moves through your circulatory system. If I cut a hole right here and let you look inside my artery, this is what you would see. You would see a wave and a valley, and a wave and a valley, and a wave and a valley, and a wave and a valley. This is how blood moves through our circulatory system. Good? Okay. You know, slasher movies even get this right. Anybody watch slasher movies? Right? You ever seen blood squirt out like this? Right? It doesn't just like spray like a garden hose. It squirts and stops and squirts and stops. Yeah, that's squirt and stop and squirt and stop and squirt and stop. So they even get this right. Okay. Yeah, if you see a slasher movie where the blood just sprays like a garden hose, that's somebody that doesn't know how this works. Tell them to call me. I'll be happy to help them for a fee. All right. So what we're doing when we're taking a pulse is we're using two fingers. We're pressing down on that artery so we can feel those waves underneath our fingers. That's all we're trying to do is feel the waves. That's it. Now, if you press too hard, you'll crimp that artery off and you won't feel any waves at all. It's like a straw. You do this to a straw, nothing gets through. So if we don't press far enough, we're not going to feel the waves because they're under where we're pressing. So we kind of have to find that sweet spot. And unfortunately, it's a little bit different with everybody. Some people have arteries super close to the surface. Other people have arteries buried way deeper. So we start light, put our fingers in place. If we don't feel anything, we press in a little bit. If we don't feel anything, we press in a little bit more. If we don't feel anything, we press in a little bit more. Oh, I got it. Okay. Don't start like way deep because you'll crimp it off. Start light and gradually increase your pressure until you feel those thumps. Good? Questions? We don't ever want to use our thumb to take a pulse. Your thumb has an artery. If we press down on the artery, we'll feel a thump, but it's ours. Doesn't do us any good for the patient. Good, so no thumbs. But our thumb is going to have a job. We'll get to that in a minute. So all we're going to do is press down on the artery and count the thumps that we feel under our fingers for 1 full minute. Pulses are always recorded over 1 full minute. I didn't say they were always counted over 1 full minute. I said they were always recorded over 1 full minute. That's an important distinction. You won't always have to count for 1 full minute. So when we're taking a pulse, you want to make sure that your thumb, remember I said we can't use our thumb to take a pulse? You want to make sure your thumb is on the underside of the patient's wrist. So if I'm taking a pulse and I take 2 fingers and put it way up here, I'm going to show you where it's at in a minute. Put 2 fingers way up here. I want my thumb on the back side. I don't want to just hang out like this. That's because as we're counting, your fingers are going to relax. Nothing you can do about it. Your fingers get lazy. They hang out in one place too long. They start to relax. And you will lose the count. 28, 29. Where'd it go? And it's because your fingers relax. If you put your fingers there, put your thumb on the back, so your fingers are in a C shape, it holds consistent pressure and you're less likely to lose it. Good? So the pulse is going to be found at the very top of the wrist, like where the lines are. Very top of the wrist, not down here. This has too much fat and muscle. You're not going to feel your artery. So way up here where the lines are, and it's just below the thumb, not over here. So trace your thumb down to your lines at the very top, and that's where your artery is. Another way to find it, you put your hand out like you're going to shake somebody's hand with your thumb sticking up. There's a bone that runs right here along the top of your wrist. Find your bone. Find your bone. Take 2 fingers. Now at the lines, don't be down here. At the lines, take 2 fingers and stand it up on that bone. Roll your fingers forward. Put your thumb on the back. You feel your thumbs? You're going to have to put a little pressure. Remember, start light, go deeper. Put a little pressure on there. Did everybody find your thumbs? It is helpful if you use your fingertips, not the flat part of your finger. Notice I did not do this. I did this. Do you guys see how my fingers are positioned? Do you guys see that? Your fingertips are way more sensitive than the flat part of your fingers. Fingertips. Good? Is anybody dead? Is anybody dead? I'll come help you find your pulse if you're dead. Did you find it?
Yeah.
Okay. Make sure that elbow is always supported. Don't ask your patient to suspend their arm in midair for a long time. Their arm is going to get tired. That will actually, because of the stress on the muscles, they require more oxygen, which speeds up the heart rate to deliver more oxygen, and you'll actually affect the pulse rate. So you want that arm on the bed as you're taking the pulse, or a table, or whatever. So how long do we count? Well, the easy answer is
4 minutes.
A full minute. 60 seconds.
1 full minute.
As long as the care plan tells you.
easy answer is always the care plan. That's right. So this care plan, this is the care plan from the state exam, tells us patient will be lying in bed for skill. Take the patient's radial pulse measured at, it even tells you where it's at, measured at the wrist for 1 full minute and record your readings. So this care plan is telling us to count for 1 full minute. What do we do with a care plan? Yeah, follow the care plan. So how long are we counting? 1 full minute. Why are we counting for 1 full minute? Starting to catch it? Okay. Yep, care plan, care plan, care plan. You know how I used to start this class? I used to make you guys play Simon Says. First thing we did.
Care plan says.
Yeah, Simon Says. Because the rules of Simon Says are you do what Simon says, you do only what Simon says, or you're out, and you do what Simon says quickly, or you're out, right? So instead of Simon, our role here is the care plan, and it gets you to kind of click with it. Okay. But here's the thing. If the care plan does not say 1 full minute, we can take a shortcut. We like shortcuts. We have got way too much to do and not enough time to do it. Shortcuts are good as long as the care plan doesn't tell us we can't. So if you look at the clock, right, 15 seconds on the clock. In order to get 1 full minute, there's 4 of those. So if we count for 15 seconds and multiply it by 4, we get our full minute reading. Good. Does everybody know how to read one of these clocks? I know that this is becoming an issue. They're not teaching this in school much anymore because everybody has digital. You do need to know how to. So basically, you start wherever the second hand is and you count until the second hand gets back to that point. Okay. For the test, this comes up a lot. You cannot use a phone, a smartwatch, a timer, nothing electronic. The only thing you're allowed to use is an actual clock that's in the testing center. You guys know why? Cheating. Yeah. Smartwatches can be made to look like regular watches. In fact, I saw one that was, I couldn't tell that it wasn't a regular watch. It looked just like a regular watch, but it was a smartwatch. And you can have things streaming from your watch into your ear, and it can tell you what to do. And that is cheating. Good? All right, let's go to 53 to figure out how to do this skill. So if we look at page 53, here at the top, we're going to see the care plan. What do we do with the care plan? Read it and follow it. It's the same care plan we just saw on the other page. Patient will be lying in bed for skill. Take the patient's radial pulse, measured out the wrist for 1 full minute, record your readings. So time out here real quick. There are a lot of pulse points in your body. There are a lot. You've got carotid up here that we use when we think a patient is dead because it's the biggest pulse and it's easy to find, right? So if we're doing CPR, we use the carotid. Just think CNC, carotid for CPR.
You still do the C though?
You can, but I usually just do 2 fingers. Yeah, because we're not counting. We're just seeing, do they have one? So with CPR, 2 fingers here. We do teach CPR. I will have one toward the end of your program. I'll give you the dates next week. Guys, can't even tell you how crazy I am. I literally have only had 4 hours sleep since we last met. So all the slides that you see here, I created yesterday and this morning. So I'm a little busy. And thank you. And these guys keep telling me, all the people in my life that try to keep me straight, because I am like all over the place. They're like, we need more dates for CPR. I'm like, I'll get to it. So next week I will have some dates for you.
Where's the sleep coming from?
This weekend. I leave tomorrow morning for a girls' weekend. I am super stoked.
Weren't you just saying something about sleep is important?
Yeah. Yes. Yeah. For the immune system. Yes, it is. It is. It is. I'm taking my computer. I will be working on slides for Monday for you guys, but I'm still going to work some sangria in there somewhere. Not a girls' weekend without some sangria. All right. So this is going to give us our pulse point. So this is going to give us our step-by-step instructions, tells us exactly what to do and how to do it. But pulse points, multiple pulse points on the body. You've got carotid. This one is telling us very specifically the radial pulse measured at the wrist. It actually tells us where that is. So that's this one. We also have another pulse in the arm called the brachial pulse, and it's up here in the elbow region, and we're going to learn that on Monday. So as CNAs, there's only 3 pulses that we use. Carotid if we're doing CPR, radial for pulse, and brachial for blood pressure. So B, brachial blood pressure, C, carotid CPR. Okay, good. Radial wrist. They sound like ours. Questions? There are other pulse points too. We have one underneath our armpit. We have one in our groin called the femoral pulse. Please don't put your hands in somebody's groin and tell them you're taking their pulse. They get a little iffy about that. We have one behind the knee called the popliteal, which is a little bit harder to feel because it's buried under way more tissue. And there's one on the top of the foot called the dorsal pedalis. As CNAs, you won't be using any of those other pulse points. CNAs usually only stick with 3. Carotid for CPR, brachial for blood pressure, and radial at the wrist for pulse.
And what scenario would you need to feel the pulse in the groin?
That would be, okay, so remember I said that most of your questions, I'm going to point to this thing up here, right? So CNAs do normal. A groin pulse is not, so who would have to do that? The nurse. Yeah. There are situations where I do need to do that. Absolutely. Particularly if my patients had a heart cath, or if they have a blood clot in one leg and I want to make sure that blood is flowing past that clot to return to the heart. If they've had trauma, I'm trying to find out whether, how extensive that trauma is. So there are situations where I would use that femoral pulse, but that's a nursing function. And CNAs do normal. That's not normal. So not our job. Okay, good. Makes sense? Okay. All right. So our care plan tells us exactly what to do. These step-by-step instructions tell us how to do it. Supplies are going to be located at the bottom of the screen. And you'll see here on this page is our documentation sheet. Now, you have full-size documentation sheets in your book. And I don't know what page, so give me a second. I still have to learn all this, guys. 168. So you've got full-size documentation sheets that you can practice with, make copies of. They're yours. All right, so let's look at the skill-specific steps to doing this particular skill. So remember that we always follow the care plan. We do our opening, we evaluate gloves, and we do our closing. That's every skill, every time. We don't even have to think about it. Those 4 steps are inherently involved. But then we have the skill-specific steps. So these are specific to pulse. They don't apply to any other skill, just pulse. Okay, so I want to go through these one at a time. You always want to make sure that arm is supported, and we talked about that, right? You don't want that arm hanging out in mid-air because the extra stress is going to require blood, because we need more oxygen to the muscles to hold the arm up. That's going to increase the pulse rate. We want accurate.
What about their legs being crossed?
So legs crossed actually doesn't affect the pulse. It will affect the blood pressure, but it doesn't really affect the pulse too much. So I thought I had this. I didn't. Okay. So we've already talked about this one. Do not use your thumb to take a pulse because your thumb has an artery. You'll get yours. Won't help you a bit. We want to use our fingertips, not the flat areas. We've talked about that as well. Radial pulse is at the top of the thumb side of the wrist near the bone. I showed you that. We're always going to report our pulse rates over 1 minute. Remember I said report is different from count. Right? So if we're counting for 15 seconds, we have to multiply that by 4 to get that full minute for our report. Make sense? So real quick, you might have a written test question that asks you, how long do you count a radial pulse for? And the answers would be A, 1 minute, B, 15 seconds multiplied by 4, C, as long as the care plan tells you to count, or D, until you hit 60.
See,
Care plan.
Care plan. So you're starting to see that I'm training you in a very specific way. Yes, the care plan. Absolutely. Guys, the written test is going to be ridiculously easy for you when I'm done with you. But before Monday, you probably would have picked either 1 full minute or 15 seconds to multiply by 4 because you didn't understand the importance of the care plan. Good? Okay. So that's really what the test is testing you on. Do you know what a care plan is, and do you know what to do with it? They figure you'll get better at partial bed bath along the way. You'll get more accurate with counting a pulse with practice. That's not what the test is about. It's not about being the best CNA. It's about, are we going to release these people into the wild with a clue? Or are they going to go out there and make stuff up as they go and put our patients at risk? That's what the test is about. Okay? Set your expectations accordingly. Normal is between 60 and 100. That's what we're hoping for, between 60 and 100. Not everybody makes it here. Some people are lower than 60. Some people are higher than 100. What do you think we should do if we get a number that's lower than 60? Yeah, tell the nurse. What should we do if we get a number higher than 100? Tell the nurse. That's it. We count. We get a number. If the number doesn't fall between 60 and 100, we tell someone who cares. That's it. We don't solve that problem. But let me give you some information about this, because I think the body is just an amazing thing. And I find this fascinating. So there is a certain population of people that will have a pulse rate that is way lower than 60. Right? Normal is between 60 and 100. But you might get a pulse rate of like 38. And they're still alive. And you're wondering, how? So let me explain this. Let me explain who these people are and why the pulse rate might be low. Well, your heart is a muscle, just like any other muscle in your body. If I did bicep curls all day long like this, clearly I don't, okay? But if I did bicep curls all day long, what would my biceps look like? Huge, man. I would be ripped. I probably need to go to the gym, but I would be ripped, right? Because I'm focusing on that muscle. I'm building that muscle. I'm engaging in activity designed to build that muscle. Well, the heart is a muscle, just like the bicep. So people that do a lot of cardio. Now, I'm not talking about 20 minutes on the treadmill. These aren't the people I'm talking about. I'm talking about the Lance Armstrongs, the people that are cycling 12, 14 hours a day, people that are rowing 12, 14 hours a day, playing tennis, running, people that are high cardio intensive athletes. Because what they do is cardio. Cardio is the word for heart. The muscle that they're building is the heart, and it's a muscle. So where my heart, pretty flabby, because clearly I don't work out the way I should, my heart goes, So it's not really pushing out a lot of blood each time because it's not very strong. So it has to, beat a whole lot more to get enough blood to my body, right? So it's going to have a higher heart rate to push out the blood. Now, if I were a cardio athlete and I worked on that heart muscle, my heart, when it beat, would go whoosh, pushes out a ton of blood. So it doesn't have to beat nearly as often as my little wimpy heart. Got it? Cardio athletes generally have a lower heart rate because their hearts are stronger and pushes out more blood. On the other end of the spectrum, you have bodybuilders. You've seen those gym rats, right? I mean, built, right? Biceps, quads, right? They're built. But the one muscle they don't work on is their heart muscle. And that's because cardio leans you out. These people aren't about leaning out. They're about bulking up. So they don't do cardio. So what we did was gave their heart way more real estate to feed, but we didn't make it any stronger. So in order to feed all of that real estate, it's got to beat faster. Make sense? So your super muscular people will probably have a higher heart rate. Your super lean cardio people will generally have a lower heart rate. Isn't that amazing? Now, the majority of people are going to fall somewhere between that 60 and 100. And when you're taking a pulse, if you get something outside of that range, you're going to report it to the nurse. And sometimes you'll tell the nurse, hey, patient's got a heart rate of 48, and they'll go, it's all right. And sometimes you'll tell the nurse, the patient's got a heart rate of 48, and watch them run down the hall. Okay. And as a CNA, you may not understand, well, wait a minute, why did they run for that one, but not the other one? Well, it's because the nurse did that assessment and knows that this patient is cardio heavy. And believe it or not, that's something that we look at during our assessment. Okay. So good? Make sense? Okay, so we're actually going to be counting with an evaluator for the test. So you've got a patient laying in bed, might be you, because it's a live patient. So we got a patient laying in the bed. We're on one side of the patient with a wrist. One of the evaluators is on the other side of the patient with a wrist. And they've got to start counting and stop counting when you do. How are they going to know when you start and when you stop if you don't tell them? Good. Now, if you look at the documentation sheet there on page 53, you'll see that there is a place for 2 pulse readings. 2. That's because on the state exam, we have how many evaluators?
2.
And they both have to grade you independently. So that means for this skill, if you get pulse, you are going to count it twice, once with each evaluator, so that they have an opportunity to grade you independently. Now, you don't have to remember the first reading. They're going to let you write it down, without washing your hands. They're just going to let you jot it down. Then you'll do the second reading, do your closing, wash your hands, document, wash your hands again. Okay, good. Make sense? Now you got to be somewhat accurate here. Within 4 beats of the evaluator's reading. Within 4 beats. That means if I, as the evaluator, got 76, if you got 72, 73, 74, 75, 76, 77, 78, 79, or 80, you are considered accurate. That is a huge margin of error. But I'm going to tell you that even if you aren't accurate with your count, as long as you do everything else absolutely perfectly, you'll get a deficiency for not being accurate, but it won't fail you. Because I know as long as you're doing it right, you'll get better with practice. But if you're doing it wrong, no amount of practice is going to help you because you're always practicing wrong. Good? Makes sense? All right, I'd like you guys to find somebody else's pulse. Just grab a neighbor. Just find a pulse. Don't count. Just find a pulse. Find a pulse. Find a pulse. Find a pulse. Go ahead. Find a pulse. Don't count it. Just find a pulse. When you find a pulse, let them find your pulse and then find somebody else's pulse.
Is it fast? I was saying, 'cause I don't have a high blood pressure. Are you supposed to support the elbow?
Yeah. Yeah.
I was
Yeah.
just wondering, 'cause you did it.
Well, we're not counting. I just want you to find the pulse. Did everybody find a pulse? Everybody find a pulse.
your time.
So bring your arm this way. Okay. Turn your hand over. Put your fingers there. Put your thumb on the back.
Right there.
Tips.
Oh wow, that's really good.
Good. Okay. So I'm okay.
Yes.
Okay. So I'm going to ask you to stand up real quick. And can you take your backpack off and put it here? And let me have your chair. We're going to play musical chairs here. Okay. Let's see here. All right. Let's do it this way. Okay, I need you to come sit here. And I'm going to ask you to come sit here for me. Let's see here. I'm going to ask you to turn around so you're facing them. And then, let's see here. So we've got you three. So, missing somebody?
She's in the restroom.
Oh, okay. That's why the math wasn't working for me. Math was not working. Okay. I apologize. I'm going to actually ask you to come over here. Sorry. Okay. You are going to sit. Yep. You're going to turn around so you're facing them. You're going to sit right here facing them. Okay. She's going to sit there when she comes in. And let's see here. You are chairs, man. Okay. You're going to sit here. There is a method to my madness, I promise. Okay. So the person on the table that is single, okay, so you, her when she comes, you and you, okay. It's also going to be you for our purposes because I am your other partner here, okay. So if I can have you come sit over here for me in this chair. She's like, what did I walk into? Okay, so the single person is the patient. The doubles are the evaluators. Or I'm sorry, one CNA and one evaluator. So you're the CNA, you're the evaluator, CNA evaluator, CNA evaluator, and so on. So you are going to find the pulse on the hand of the patient closest to you. So find your patient's pulse. Don't count. Find your patient's pulse. So stretch your arm out over here, and you're going to find the pulse. So we should have two. Patient has two arms. They should. No, that arm is going to go over to her, and you're going to find it over here.
I want to know what. I forgot how you laid it out for me. She made it so easy.
We're going to come a little bit more there.
Bone trick. Like find the bone.
Not, you're not going to count yet. Just find. Just fine. Don't count. Just find. Don't count. Just find. You want to be more up here. There you go. Put your thumb on the back. Okay. You got it? Got it? Okay. Find it and hold your hand there. Find it and hold your hand there. And I'm actually going to move you over to this hand. Just like that. Because I'm going to take this one. All right. So, does everyone have the pulse? If you do not have the pulse, tell me. Okay.
I got it.
Got it? Everybody ready? When I say start, I want you to count the thumps underneath your finger until I say stop. Okay. That's fine. Okay, so when I say start, you're going to count the thumps that you feel under your fingers until I say stop. Everybody ready? Start. Stop. What'd you get?
I had lost it for a minute.
Okay, that's okay.
So I ended up with like 26.
Okay.
I got 57.
Oh, okay. All right.
68.
Okay.
64.
Okay. Very good. I got 81. Very good. Okay. So now the patient, the person that was just the patient, becomes the CNA, and one of the other two is going to become the patient. So stay where you're at. Just the person who was just the patient is going to be counting. Okay, so somebody else, put your arms out. Go ahead and put your other arm out. Yeah. So
Yeah.
let me help you real quick because there's a different way of holding. So if you come over the top, there you go. That might be more comfortable.
Oh, I do have to press.
Okay. So when you have the pulse, please say yes.
Yes.
Got it? Got it? Yep. Yep. So other hand. Yep. No, no, no. You're going to do him. So the patient has both of their hands out. So put your hands here. Yep. The patient should have somebody taking a pulse on each of their hands. Okay. Okay, you're way too high. So you want to be down here. Okay, you're welcome. All right.
I'm an expert at this.
All right, everybody have a pulse?
Yes.
Ready, set, start. Stop. What'd you get? What'd you guys get? Okay.
Yeah, but no, I
Okay.
can't tell what it was.
What'd you guys get?
66.
Okay. All right.
67.
Okay. And I got
I
76.
got 73.
Okay. Very good. Very good. All right. So you starting to get it? All right. The last person who has not been a patient now is the patient. So somebody should be taking a pulse on each one of your hands. I am ready. Actually, let me do this. I'm going to have you kind of, Nope, nope, nope. You're going to just scoot this way just so I can see the clock.
I thought that. I was wondering.
So go ahead and find the pulses. Let me know when everybody has the pulse. Does everybody have a pulse? Move a little bit closer to the ceiling. Up. Yeah, there you go. Just a little harder.
Oh, I pressed too hard.
Right there. Press a little harder. Does not hurt.
Okay.
Got it? All right, ready? Start. Stop.
I lost it for a second. As far as I got was 88.
Okay. Good. Okay.
I have a trace for how fast it was going. So
Okay.
I had to like guesstimate.
Very good. Okay, you can go ahead and resume your seats.
Oh, you got that roll?
Drag your chairs back to wherever they go. If you can put that over there for me. And I'll take that one. I'm going to give it. Bring this over here.
You want this upper extra as well?
No, you can leave that one there. Thanks. Okay. So when you were the patient, how long was that minute? Oh my gosh. It really is. It's like, isn't it over yet? Your patients are going to feel the same way. If you have to count for 1 full minute, remember they're used to people counting for 15 seconds. So if this is dragging on and on, they're automatically going to think there's something wrong. Every patient immediately goes to, am I dying? Am I dying? Now, because of that anxiety, what do you think that anxiety is going to do to their pulse rate? Yeah, so we're not going to get an accurate reading. It's also going to cause your patient to talk because people that are nervous tend to chatter. Okay. So if you have to count for 1 full minute, you need to let your patient know, hey, I'm going to count for 1 full minute. I will need you to be quiet during this, but I'll let you know as soon as I'm done. Okay. If you do that, your patients tend to stay quiet. They expect it to last for a minute. There's nothing unusual here, nothing to see. They may take a nap, right? But if you don't, if you just come in and take a pulse and it lasts and lasts and lasts and lasts, they're going to look up and go, what's wrong? And that's going to totally derail your count. Does that make sense? So talking to your patients is a key component of this skill. Any questions on this? One other thing, when you're timing this, now for this exercise, I did the timing. Okay, I took care of the clock part. For the test, you're going to have to work that into. So when you're practicing, make sure you're looking at the clock and timing it. But when you are timing, don't stare at the clock. How many seconds are in a minute?
60.
What's our normal value for pulse? 60 to 100, right? So if you get 60, you're not going to think anything about it. You're going to think, oh, it's normal. But the problem is that your brain is hardwired to accept stimuli in a very specific order. Your brain will always pay attention to what it sees first, then what it hears, then what it feels. What are we counting? Yeah, what we feel. If you're staring at the clock, your eyes are going to count the seconds. Your brain can't help it. It's how your brain is wired. So if you're staring at that clock, you're probably going to get 60 as a pulse rate. Was the pulse really 60? We don't know. Okay. So you want to look at the clock, you want to pick your starting point, and then you want to look away. And then every so often, you're just going to glance back at that clock to see where you're at. Remember that normal is between 60 and 100. I don't even look at that clock. I don't even glance back until I hit 50. Right? Because normal is 60 to 100. Chances are, right, it's going to be over 50. So I look at the clock, pick my starting point, and I look away. I don't look like way away. I just look away. And then once I get somewhere around 50, I'll glance back. Oh my gosh, we're not even halfway there yet. I got a while to go. Or, oh my gosh, we're almost done. If we're almost done, I'm going to glance a little bit more frequently until I get to that end. Does that make sense? Good. Questions on pulse? Page 53 of your book has step-by-step instructions exactly how to do this. And all we practiced so far was the actual pulse taking. Please remember that we have an opening. Knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to get your pulse. Is that okay? Close the curtain, wash my hands. Come back to my patient, find the pulse, pick a starting point on the clock, and say, start. I'm going to count what I feel for 1 full minute until that second hand goes all the way back around to that starting point and say, stop. I'll get to write that number down, and I'm going to count with the second evaluator. After counting with the second evaluator, I'll do my closing. Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? Would you like a magazine before I go? Your environment is clean. The bed is low. You're in a safe position. I'm going to open the curtain, give you your call light. If you need me, press the red button. I'm going to go wash my hands and then document my skill and wash my hands again. Good. Questions? I'm not going to show you the video on this. I have one. It's on my website. I'm going to send you. Did everybody get the wrap-up email? Okay, you see how there's links in there for all the videos? So the wrap-up email from tonight, you'll have a link to the Pulse video. You can go back and watch it if you want to. Right now, we're going to go ahead and take a break. And then when you get back, we've got 2 more skills to learn and 3 more principles. Okay? So I'll see you in 15 minutes. Come back at 20 after. So you got 13 minutes.
Is respiration going to be next week's thing?
Right. If you look at the syllabus, you'll see that respirations is on Monday.
Okay, I'm gonna go.
I left that out.
Place. No worries. Thank you.
Okay, while we're waiting to get started, I'm going to go through some of these comments. Let me grab my microphone. All right, YouTube world, while we're waiting, I'm going to go ahead and respond to your comments. Hello, Jorge. Good morning. Good morning, Amarsha, Yolene, Deanna, Helena, Melissa, Helen. Hey, hey, Debbie. Oh, thank you, Jorge. Jorge loves our method. Helen asks, can you please tell me the price of the yellow cards that contain the care plan and also the book for the questions and answers for the written test? I need those two for now. I'm going to send you the links. Give me just a second. Bear with me. It takes me a minute to get these up and running. Okay, so the first link I'm going to give you is for the book. And the book is normally $42. It is right now on sale for $38. And then the care plan sets. Copy. Care plan sets. I'll give you a link for that as well. Care plan sets are $42.99. Awesome. And Caitlin already put stuff in there put the links in there. That's awesome. I love having an assistant that's on top of things. Debbie says, Miss Patty, how do I count while doing the respiration? Cue me in as to when I should look at the clock, please. Yeah, we kind of went over that. It's the same for respirations as it is for pulse, Debbie. Go back and rewatch that section right before break, and that will help you. We'll also go over it again when we go over respirations on Monday. Marie says, good morning. Good morning, Marie. All right. Yeah, Caitlin, you are on top of things. I love it. Love it. Go ahead. Okay. Any questions before we move on? How many of you guys have brushed your teeth this month? Okay, awesome. Hey, that's good. So, if you've brushed your teeth in the last couple of weeks, you're pretty familiar with the process. Brushing somebody else's teeth is very similar to brushing our own. But there are a few small modifications we have to make because we are standing over a sink. So that does change things a little bit. So mouth care is the next skill that we're going to go over, which is brushing teeth. Nothing complex here. You already know these steps, guys. Okay, there's nothing new and earth-shattering. It's just brushing teeth. The new and earth-shattering stuff has to do with the position our patient is in and the fact that they're not at a sink. So those are the specifics that we have to work with. Now, this skill has a whole lot more principles, though, than what we've learned so far. We know skill rules because we follow the whole care plan, Ann. Okay. We know how to start every skill. Every skill starts with the opening. Every opening starts with a knock. We know how to evaluate if we need gloves. If we're going to touch anything ooey gooey, personal skin or open skin, we need gloves. We don't know barrier rules, linen rules, or basin cleaning, so we have to go over those to learn how to do this skill. We're going to learn some very skill-specific steps, and then we're going to do the closing, which we know how to do. make sure the patient is in a clean and safe environment, covered, open the curtain, give them the call light, all those C's. These are all the steps. So you can see that this skill has quite a few more steps to it. There's a video for it, and here's a short version to kind of get the lay of the land. Test specific information is at the bottom. And we're going to get into the principles that govern how to do this skill now. So 3 new principles to learn. I told you you're going to learn 4 principles today, right? So we learned glove rules already. And I'm going to teach you these 3. I'm going to make them just as easy as when we learned glove rules, okay? Lecture's a whole lot shorter. Gloves takes me a long time to talk about because I've got to break down your misconceptions before I can build new ones, okay? So we're going to learn barrier, linen rules, and basin cleaning. We want to start with barrier. So barrier rules are going to be featured in quite a few skills. All the skills that have supplies are going to need this rule. So if you look on page 84, you can see all of the skills that are going to use this particular principle. Nowhere. Not the right ones. Hold on one second. I want to give me 1 second here. I forgot to grab these on break. Okay. So Jake's going to bring something in so I can show you. So this particular page has the banner, has our 4 steps that we have to learn, shows us all of the different skills that this principle is going to apply to. You can see there's quite a few there that we're going to be using. I also have a video on this, so you can watch the video if you want to. Those of you that got into the online program, I have a whole lesson on this that has the video, interactive activities, frequently asked questions, practice questions, very full featured. So you have a whole lesson on this as well. Okay. So our instruction is going to be found on page 85 for barriers. It's going to tell us all about how to use them, why to use them, when to use them. But reading, that's kind of boring. I'd rather talk about it. So overbed tables, these guys right here. These things are used for meals and everything else. Thank you. I just need one. I want to show them. Thank you. Okay. Yeah, I don't know what happened to my classroom copy. I just wanted to show you this while I had that up on the screen, because I forget to go over these and then students get mad at me because if I had known, I got to get better at that. All right, so these are flashcards that go with the class. You don't have to have them. You can make your own. But they are here for you. So the back, so this is the front, the closing, right? The principle. The back shows you all of the skills that principle is used in. So I have this for every single principle that we go over. These are part of the flashcards. I also have the supplies for every single skill. You have to learn the supplies. And then I have the steps for every single skill that we learn. So these flashcards are really helpful as a review. You don't have to buy them. You have all of this information in your book. You can make your own. But if you do want to get these while you're enrolled in the program through graduation day, I give you guys a break on it. they're only $14.99. They're going on the website, I think they're $19.99, but they're going up to $24.99. So you getting them for $14.99 is a good savings. Okay. All the way up till graduation. Yep. Yep. So, and like I said, this information is in your book, but that page just reminded me that I needed to show you the flashcards. All right. So overbed tables are used for meals and to hold absolutely everything else. Chapstick, cell phones, crossword books. They're not clean. We can't pretend that they're clean. There's probably grape jelly from breakfast and brown gravy from last night's dinner on them. Some patients will even put their urinals on there.
Oh, cute.
Yeah. So we can't assume that those tables are clean. Let's talk about what we're going to do. Okay. So the supplies that we use for each patient are clean, and we have to have a place to put those supplies. So if the supplies are clean and the table is not, that's a problem. So how do we devise a system where we can put our clean supplies in a clean place? Well, you could wipe the table down, but that's a long process and not always effective because we don't always have the wipes, the disinfectant wipes in the patient room or within reach. So for the test, we're going to use a slightly different option. We are going to use a barrier. Now, a barrier can be anything, anything. A barrier could be a paper towel. It could be a bath towel. It could be a Kleenex. It could be anything that separates your dirty surface from your clean supplies. But for the test, we're going to use a very specific kind of barrier. I'm ordering a follow me device for my camera that will follow me around the room. It is super cool. It is insanely expensive. Insane. But I'm hoping to have it before you guys are gone. So, all right. So let's talk about our barrier. For the test, we're going to use a very specific kind of barrier. This is it. It comes in different colors. You'll see blue, mint green, beige. I mean, they come in all different colors. Color really doesn't matter. What matters is that this has an absorbent side and a waterproof side. And we use this for the test because we're working with water a lot. We don't want that water to spill through onto our surface. So when we use a barrier, we open it up and we're going to put it on the table with the absorbent side facing up and the waterproof side down. Okay, good. All right, so let me introduce this to you. This is a disposable underpad, which is a whole lot of syllables. And nobody ever calls them disposable underpads. This is a kind of underpad that we chuck it when we're done with it. So we actually call them chucks. That's how they got their name. Now, this is a little bit different than this guy over here. This is an underpad, but it is a washable underpad. So we have a washable underpad and a disposable underpad. If I'm going to call that a chucks, I need a nickname for this guy too. So this guy is a bed pad. Bed pad, chucks. We don't use these in the test, but I want you to know what they are. Okay. So bed pad, if somebody tells you to use a bed pad, that means it's the washable one. If somebody tells you to get a chucks, that means it's the disposable one. Any way that you use these, you want to make sure that the absorbent side is facing up. Okay, good. Questions? Chucks. You'll also hear patient gowns being called Johnnies, but I don't know why. I don't know the story behind that.
Me neither. That's the first time I heard that.
Yeah, Johnnies. Yeah. Marie says, good morning, Miss Patty. Please, I would like to know after feeding, which skills else I don't need to close the curtain for. Well, we'll be actually talking about that in a upcoming session. So feeding, we actually are going over on class 6, which is 2 weeks from today. So you'll want to tune in for that. But feeding is the only skill that we don't close the privacy curtain for. Everything else, close the privacy curtain for. Okay. So in order to make this unclean table surface clean for our supplies, we're going to go get a barrier and put on the table. Good? Now we got a clean place. All right. So the supplies are clean. The chucks is clean. So it's going to provide a clean area to place our clean supplies. Now, we don't want to touch those supplies with dirty hands. We only touch supplies with clean hands. So when do you think that we need to gather our supplies? After we wash our hands. You guys got that? One of the most frequent testing errors, because you have to learn supplies, right? Nobody's going to tell you. I'm not going to say, Lindy, is that right? Lindy, oh, I got one. Yay. I'm not going to say, hey, Lindy, I need you to go give a partial bed bath to room 212, and I need you to take in with you a basin, soap, lotion, 4 washcloths, 2 towels, a privacy blanket, and a hospital gown, and a set of gloves. I'm not going to do that. I'm going to say, Lindy, go give a partial bed bath. You have to know the supplies you need for each skill. That's going to be memorization on your part. No way around it. Well, when you get into the test, of course, everything leaves your brain, right? You're nervous. So what a lot of people do in the test is they're so scared of forgetting the supplies that they forget the opening. They go straight to supplies. And they don't do the opening. They don't close the curtain. They don't wash their hands. They don't get a barrier. They just go straight for supplies. What do you think that does to their test score? Oh, big time, because you're not graded on supplies. There is no check mark that says got the right amount of supplies at all. But everything else I just mentioned has a check mark. Make sense? So be careful there. You have to learn supplies. But remember, you can't get your supplies until after you've done your whole opening. Knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? Close curtain, wash hands, get supplies. Good? So we have to wash our hands before we get our supplies. Clean hands, clean supplies. Now, this you're going to see again. This step actually shows up on 2 different principles banners. If it shows up twice, it's twice as important. It means it's a step that gets missed a lot on the state exam. So I'm giving it to you twice because I need you to get it. Does that make sense? Your uniform is not clean once you start work. It is not. It has knelt on the floor for foot care and to empty the drainage bag. It has leaned against the bed when you turn a patient over and get them dressed. It's brushed up against the curtain. It's leaned against the sink. Your uniform is not clean once you start working. That's an important principle that you need to know. That means that none of that clean stuff can touch your uniform. You can't hold that stuff up next to you when you're getting your supplies. You also, when you're getting rid of your supplies after you've used them, don't want to hold that stuff next to your uniform because you don't want to contaminate yourself further. Does that make sense? So basically, nothing should touch your uniform. Got it? This is a commonly missed checkpoint. Remember that you've leaned against the bed, the sink, the curtain, knelt on the floor. You've got cooties all over, head to toe. So what happens is when you go get your supplies, a lot of people will get the barrier and their supplies all in one trip. You're trying, to like cut down on movement, right? So you go to the supply shelf, you get everything you need, but you have to unfold this and spread it out on this table. You need 2 hands for that. And if you've got all those supplies, you're not going to be able to spread this out on the table without putting those supplies right up against you. Got it? That is a commonly missed checkpoint. So the way that we do this, because it takes 2 hands to spread that barrier, and we can't let supplies touch our uniform, we are going to go get that barrier first before you get your supplies. Then you'll spread that over the table. After you have the barrier in place, you can go get the rest of your supplies. So your steps are right here. Get the barrier first, spread it on the table, and then go get the rest of your supplies. This matters. Otherwise, you contaminate. Remember I said this is going to show up on 2 principles because it's that important. Okay? Remember, most of the things that we use, most of our linens and stuff, we are going to be using on a wet body opening. Think about it. Mouth care, wet body opening. Partial bed bath, face, wet body opening. Peri-care, wet body opening. Catheter care, wet body opening. Almost everything that we're using supplies for is going to bring a pathogen to a doorway. You don't want those supplies to be contaminated before you ever get started. Good? All right, so here are our 4 steps for barrier. It provides a clean area for our clean supplies. We only touch supplies with clean hands. Don't let the supplies touch your uniform, and get the barrier first before you get your supplies. Pretty easy, right? We're going to use this anytime we use supplies. So if you have a skill with supplies, go get the barrier, put it on the table, go get your supplies. 2 trips. Yep, need to know it. That's why it's a principle. Need to know it. Now, you're going to hear this over and over and over and over and over again. So by the time I'm done with you, this will be second nature. You would never not do it this way because I'm going to drill it into you. So don't worry about memorizing it today, but I want you to be aware of it because as we go through the program, you're going to be using that principle quite a bit. Okay. So now that we've mastered barrier rules, let's move on to linen rules. And we're not actually going to cover the whole linen rules. We're going to cover a few of them and come back to it a little bit later. But linen rules found on page 86. You can see how many principles or how many skills this principle is part of. It's quite a few. So you're going to see this over and over and over and over again. But let's get familiar with it, at least some of it. Again, I've got a page for you to read, 87, but that's boring. Let's talk about it. So you already know this one. Linens must not touch your uniform. If I say it twice, it's twice as important. You also know this one. You must have clean hands to get your supplies. Right? So those 2 things, super important. They're mentioned on both barrier and linen rules because it's a commonly missed checkpoint. Remember that principles that are repeated are doubly important. They will count against you on the state exam. So the next principle is one you haven't heard. Don't snap or shake the linens. And let me explain what I mean by that. Oh, I should have put the picture up here. So I've got a puppy. She's adorable. She's a little tiny toy Labradoodle, all black. And her name is Annie. And I call her Annie the Annihilator because she is all teeth. And she ate my duvet. I mean, ate it. Like, ate it. And there are feathers everywhere in my room. Yeah, so it's like a comforter. She ate it. Feathers everywhere. So I really, and my husband cleaned it up last night, and I really should have done this while I was thinking about it when I had feathers all over the room, right? So if I have feathers all over the room, and I come along and I take a blanket and I do this, what do you think is going to happen to all of those feathers? Okay, so it's just going to explode into a feather extravaganza, right? So on this bed are not feathers. There's pathogens and skin cells and yeast and all kinds of things that have shed off of our patient. So if I did this and feathers flew everywhere, if I do that over a patient, pathogens are going to fly everywhere. So what do you think we should not do? Yeah, shake or snap. Instead, we're simply going to unfold and lay on the bed. Good? Questions? Okay, so don't snap or shake the linens because this is what you'll end up with. And what actually happens is that when you aerosolize all of those particles, it creates a vortex actually. Sprinkle some baby powder on a bed and snap a sheet over it, and you can actually see the vortex that it creates. Well, when you do that, all of those things end up right here, right around your face level. So that means you get to breathe all of that in. Now at home, I do this in my sheets at home, right? We all do. And I'm only breathing in my own funk. It's not that bad, but I really don't want to do that in a clinical setting because remember, these people have germs that are bad enough to make them sick enough to not be home, right? I don't want that in me.
Does this apply when you're removing clothing and stuff like that?
Right. You want to minimize the snapping. Basically, it's the vortex action that we're trying to prevent.
Like socks and compression socks and stuff.
Yeah. Compression socks are a great illustration because we are all underhydrated. I mean, everybody could use some lotion. Especially as we age because our skin gets super dry. You try to take compression socks of an older person and it's going to look like a snowstorm. Yeah. I mean, just skin cells everywhere. So you want to try to not shake it and aerosolize that. Okay. I know, snowstorm. Okay, so the last principle we're going to learn here on this, or the last step on this principle, notice I've got a couple blacked out here, right? We're not going to cover these yet. We'll get to these two a little bit later on in the program. I'm only focusing on the ones that apply to the skill that we're learning right now. Okay, so our last step that we have to know is unused items must be discarded. So this is not a situation where if I take too many washcloths, I'm just going to leave them in the room for later. You either use it or you lose it. It's that simple. Do not keep anything for later. anything that's out of our sight that we can't see anymore can't be considered clean. Let me give you an example of this. So we've got this CNA that's in a patient's room, had some extra washcloths, put them on the chair because there's nowhere else to put them. So puts them on the chair. Wife comes in to visit husband, has a cup of coffee, kind of trips a little bit, walking in, coffee spills on the floor. She looks around, she's looking for something to clean up the coffee. She doesn't want to leave it on the floor, sees the washcloths, grabs a washcloth and cleans up the coffee. So far, so good, right? Something all of us would do. But there's no hamper in the room. We don't keep dirty items in a clinical area. So there's nowhere for her to put this washcloth. So she's like, what do I do here? So she folds it up and she puts it right back on that stack. And a little while later, you come in to use those washcloths on husband's something.
Personal skin.
Yeah. Is that a good situation?
Oh, no.
So if it's out of our sight, we have to consider that it's probably contaminated. If she didn't spill the coffee and wipe it up with the washcloths, then she probably sat on the washcloths because they're in the chair. We can't consider it clean. Good? So use it or lose it. We'll cover the rest of linen rules in an upcoming lesson. Good? Okay, so just to recap, linens must not touch your uniform. You have to have clean hands to get your linens. Don't snap or shake them. And unused items must be discarded. Use it or lose it. All right, so the last principle that we have to learn is a little more complex. This is basin cleaning, and this trips students up a lot. This one's complex, but I'm going to tell you, you don't have to know it all today. You're going to see this over and over. In fact, it's featured in quite a few skills. So the thing to remember, page 90, sorry. The thing to remember is that we clean everything the same way. Doesn't matter what it is. Immersive basin, bath basin, bedpan, graduate container. If it's patient use, we clean it all the same way. And for the most part, we don't disinfect. So page 91 has your lesson. You can read it on your own, but for me, it's more fun to talk about it. So our basin cleaning rules start here. Where do you empty it? Well, where it would normally go. Don't get too wrapped up in this. I mean, people make up stupid rules for this. Like silly. Oops, you guys can't see me, can you? Silly rules, right? It's not complex. Where would it normally go? Like when you brush your teeth, where do you stand? Over the toilet? The sink. Yeah. So if you've got somebody that has urinated into a bedpan, where does urine normally go? Okay, so put it where it normally goes. It's, I mean, don't make this complex. Dump it where it normally goes, right? All right, now once we've dumped it, though, our cleaning begins. Now, the first thing that you need to remember is that we're not trying for sterile. Okay, this is not sterile. We're looking for clean. So how many of you guys brush your teeth over a sink? How many of you disinfect your sink every single time you use it? Hey, I'm lucky if mine gets cleaned before company, right? Maybe once a week, I'll run a cloth over it. But for the most part, I just rinse out the big globs of toothpaste and call it a day. That's all we're doing here, guys. We're rinsing out the big globs of toothpaste and calling it a day. We are not disinfecting for the test. We are simply going to rinse, dry, and store. Got it? We're not going for sterile. These basins that the patients use, they're the only ones that use it. So a bath basin like this is issued to one patient and one patient only. Their neighbor does not use it. It is all theirs. Emesis basin, one patient only, all theirs. Bedpan, one patient only, all theirs. How many of you guys would like to have your very own toilet that nobody else ever uses? Sign me up, right? It's what a bedpan is. Okay. So we're not looking to sterilize anything. We're just simply trying to get it clean to store it. That's all. Good? So we dump it where it normally goes, wherever that is, and then we're going to rinse our basin. Doesn't matter whether it's a bath basin, an emesis basin, which is that small kidney-shaped little guy, or a bedpan, or anything, whatever it is. Okay, we're just going to rinse it. We're going to dump the rinse water wherever we put the stuff that was in the basin. So if you dumped the stuff in the toilet, you dump the rinse water in the toilet. If you dump the stuff in the sink, you dump the rinse water in the sink. So this isn't complex, right? So far, pretty easy. Okay, this is where it starts to go a little off course. Because for the test, all we're going to do is rinse, dry, and store. That's it. We can all figure out how to do that pretty easily. But I have to teach you a method that allows for disinfection to happen. Because there will be some times that the care plan will tell us to disinfect. So we have to have a process that works for the test, rinse, dry, store, but also allows disinfection to happen if it needs to. Good? So I'm showing you this process in case you ever need it, but we're not going to use it for the test. Kind of clear? Okay. So we dump it where it normally goes. We rinse it and dump the rinse water wherever we put the stuff. Then, yeah, we already know that. Then, if we have to disinfect, we have to understand we can't hold that basin while we're spraying it. Gloves are dirty. You can't be holding the basin with dirty gloves while you're spraying it. That means you got to let go of the basin to spray it. So we're going to set it down in the sink. Once we set it down in the sink, then we can spray it. Back here. Then we can spray it. Good? Once we've disinfected, then we will use a paper towel to pick it up because our gloves are still dirty and the basin's been disinfected. Good? Following me so far? Okay, once we pick it up with a paper towel, we want to find the right thing here. Once we pick it up with a paper towel, we want to dry the inside, throw that away, dry the outside with a different paper towel, throw that away. And then we need to get one more paper towel to get our supplies and open the drawer. Because remember, your gloves are still dirty. Good? Make sense? So for the test, we're going to do all of this except for spray. So I'm going to dump my basin where it would normally go. I'm going to rinse it out, dump the rinse water where it normally goes, and I'm going to set it down in the sink, hands off. Then I'm going to use a paper towel to pick it up, paper towel to dry the inside, paper towel to dry the outside, and one for the supplies in the drawer. The only step I don't do for the test is actively spray. Every other step is demonstrated. Good? And that's because during the test, they don't know which ones of you have asthma that's going to be triggered by the disinfectant spray. I would. You see me coughing all over the place. Does this make sense? You're going to see this. I'm about to show you a video for mouth care. You're going to see this whole process. Don't panic if you don't get it right away. You're going to see it again and again and again and again. You started to notice there's a lot of repetition in this program. Like, I don't expect you to get it the first time I say it or the second. Might sink in on the third. And then I'll do it 3 more times. So by the time you leave here, this stuff is so ingrained in you that when you get to the test, you don't have to think. I don't want you thinking on the test. I want you just to be able to go in there and do it.
Because a nurse doesn't think they do.
That's right. Good? Okay. All right. So after we get all that done, we'll throw those paper towels away. So you're going to see basic cleaning a lot of skills. Don't worry if you don't get it right away. We'll be going over it again. But these are the steps, and you can see them on the banner back there. It's also in your skills book, and I always have them here. All of these are all of the banners. Okay. So what you see there is the artwork I made for these. So you have access to these while you're in here. There are also pages in your skills book as well. All right, so page 89 talks about ADLs. I'm going to make this short and sweet. ADLs are what we do. CNAs perform tasks on patients that they cannot do themselves. If your patient can brush their own teeth, they will. If they can't, we will. But for the most part, CNAs are going to help patients with personal care tasks that they would be doing on their own if they're able to. We'll also help nurses with some nursing tasks like pulse, we learned earlier. Good? But ADLs is what we do. So if you had a written test question that said CNAs predominantly provide what kind of services to patients? 1, assistance, or A, assistance with ADLs. 2, invasive procedures. 3, complex diagnostic procedures. Or 4, whatever they think is appropriate. ADLs. Yeah, so these written test questions are not very hard. Not when you understand your role. So here's the page 92 that tells you all of the principles. Remember, I told you we'd come back to this. All of the principles that are involved in this skill. So this skill's a little bit longer. If you look at the bottom of the page, down here, you'll see that somebody with your level of experience should be able to provide mouth care on a patient for the test within 12 minutes. Guys, we're brushing teeth. Has anyone ever taken 12 minutes to brush teeth? Not even on a squirmy 2-year-old. Yeah, you've got plenty of time here. Way more time than you actually need to get this skill done. Do not rush. When you rush, you skip steps. Okay? Good? All right, so our steps are located on page 93. This tells us step by step exactly how to perform this skill. Hold on one second. I got to fix something here. Okay. This tells us exactly how to perform this skill, but there is a critical concept step here. Remember we talked about this on Monday, that there are some steps that if you forget to do them, they will automatically fail you. Those critical concept steps, things that put our patient in immediate jeopardy. This skill has one, and it has to do with the position that the patient is in. So is this a safe position? No. So what do we need to do? So we need to get them sitting upright. Now, this poses a problem for you guys because you just learned all about infection control. And this is a problem. So we know that our rule is, if we go back and look at that banner for the opening, we know that our rule is we cannot touch our patient until we have what kind of hands? Clean hands, right? So that means we got to do our whole opening, close the curtain, wash our hands before we can do anything. But we also know we have to put this head of the bed up. And we know that bed controller is touched by absolutely everybody. Is that thing clean? No. So that's a problem for us, isn't it? Well, wait a minute. I've already washed my hands and I have to put the head of the bed up. How am I supposed to do this? Well, the best way to do it is to grab a paper towel and use the paper towel to put the head of the bed up between your hand and that bed controller. And that provides a barrier which keeps your hands clean. Okay, good. Questions? I know, infection control, it'll trip you up. So if you look at step 7, you'll actually see use paper towel as a barrier to raise the head of the bed to the full sitting position. Not until they're comfortable. This has got to be all the way up. And you probably will need to adjust the pillow behind the patient as well. Because when you sit that patient up, that pillow is going to be behind their head. It forces it forward like this. This is not safe. If you have them lean their body forward and put the pillow down behind their back, it sits them up straight. Okay. But remember, you can't touch the patient until your hands are clean. So we can't do any of that until after the opening. Starting to put the pieces together? Okay. So dignity is important. We want to protect them from toothpaste. So what could we put over their chest? Bib, barrier, towel, washcloth. I don't care. Pick something. Something. Protect that clothing. We want to wet the toothbrush before we put toothpaste on it because just like, remember with hand care or with hand washing on Monday, we said that if we don't wet our hands, it doesn't spread the soap around well. You guys remember that? So with hand washing, you have to wet your hands before you put soap on. Same process here. We want to wet the toothbrush before we put the toothpaste on because toothpaste won't distribute in the mouth if the toothbrush is dry. It just globs up. Okay. Good. So what are we brushing? Whatever the patient's got. Whatever they got. If they have gums, we'll brush gums. If they have teeth, we'll brush those. If they have a tongue, we're going to brush it too. If they don't have a tongue, tell the nurse. Quickly. Okay. Whatever they've got. There is no time requirement here, guys. You don't have to brush for 2 whole minutes. There's no flossing. This is not complex. You're brushing the teeth. Top, bottom, front, back, tongue. Good. Whatever we brush, they probably need to rinse. Here's a helpful tip. The more toothpaste you use, the more they're going to have to rinse. A little dab will certainly do you. When you are brushing your teeth, you probably load that sucker up. You don't need to do that. Literally a pea-size amount is all we need. Now, the toothpaste makers, they want you to keep loading it up because that means it's, you got to buy more toothpaste. They're all for that, but you only need a pea-size amount. If you're brushing somebody else's teeth, don't use any more than a pea-size amount because it can choke them. It's too much in their mouth. They're not over a sink. It's hard for them to spit it out, but it's also going to take a whole lot of rinsing and rinsing and rinsing, and you'll be there for that 12 minutes. Okay, little bit of toothpaste. Let them rinse as often as they need to. Okay. You want to dry that patient off because nobody wants to be a wet, drippy mess. That just makes sense, right? Dry your patient off. So our test-specific steps here, just to go over it one more time. And you can have this, this page open when I'm showing you the video. Make sure that I hit every single one of these checkpoints to make sure that I'm showing you correctly. These are the checkpoints. So it's a way for you to double check me. Here's the thing, guys. You have no idea if I know what I'm talking about. You have no idea. You are trusting me. Thank you very much for your trust, by the way. But you honestly have no idea if I'm leading you in the right direction. You also don't know if anybody else out there is leading you in the right direction when you're watching videos or taking practice tests. You should always double check your sources to make sure that they're correct. This comes strictly from the testing checklists, which you have access to right here. Feel free to double check. Make sure that the sources that you're using are correct. Okay? I bring that up because every class I have somebody that calls me in a panic because they were watching a video and they're saying, you didn't show us how to do this, and I'm afraid I'm going to fail. And my answer is always, don't take my word for it. Look it up on the checklist. Okay? Good? All right, so our patient must be sitting fully upright. We're going to protect the clothing, wet the toothbrush before applying toothpaste, brush all surfaces, allow the patient to rinse and spit, and leave the patient's face and clothing dry. So, common question here, and then I'm going to show you the video. Do I have to brush everybody's teeth? No. How do we know whose teeth we have to brush? Care plan. The nurse has done all the work for us. Now, if we aren't doing mouth care on somebody and we notice they're not doing their own mouth care, what should we do? Tell the nurse. Yeah, because there's an unmet need there. Okay. Whoops. All right, Caitlin, if you would please, can you, or no, I'm sorry, never mind. I know I got to play it. I forgot. Let me hit play. I'm working. I know it's very low. Still got to figure out how to do that.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
Good, how are you?
Wonderful. I need to do mouth care. Is that okay?
Yes.
Okay, I'm going to put the head of your bed up. And then I'll close the curtain, wash my hands, and gather my supplies.
Okay.
We'll get you to a full upright sitting position for safety. And if I can get you to lean forward, please. There you go. Is that more comfortable?
Yes, much.
Okay, I'm going to close your curtain and wash my hands now. I'll gather my supplies. Okay, so I want to point this out. I'm getting ready to redo my videos. If you notice, I told you to put the head of the bed up after you wash your hands. That is a change from what you see in this video. So the video, I put the head of the bed up and then washed our hands. The reason that changed is because we now have that checkpoint, refrain from touching patient until hands are clean. That is a new checkpoint, okay? So I wanted to point that out. I'm going to start with the barrier, and we'll place that on your overbed table. I'm going to get a towel, a set of gloves. a basin, toothbrush and toothpaste, and a cup of water. We'll prepare the toothbrush first. We'll get it wet, place a little bit of toothpaste on it, and set it in the basin. Mr. Jones, can I place this towel over your chest?
Yes, please.
Okay. And now I'll apply my gloves. Okay, Mr. Jones, can you open wide for me? I'm going to brush the back on the bottom. The back on the top. And can you bring your teeth together? And stick your tongue out for me. Thank you. Set that aside. Go ahead and take a sip. Rinse your mouth. Let me wipe that off for you. Another sip.
No, thank you.
Okay. Now I'm going to dispose of my cup, wrapper, and toothbrush. I'll be right back. I'm going to remove the towel and place it into dirty linen. Going to go clean the basin, and I'll be right back. I'll place the toothpaste in the basin, use the paper towel to open the drawer, and place the basin and toothpaste in the drawer. I'll clean up my work environment and go throw these items away. Now I can remove my gloves. Okay, Mr. Jones, is there anything else I can get for you while I'm here?
No,
A
thank you.
magazine?
No, thank you.
Okay, your call light is right here. If you should have any needs, let me know. Can I adjust the head of the bed for you?
No, this is great.
Okay, I'm going to open the curtain and go wash my hands. After washing my hands, I'll think about my skill, make any corrections I need to make, and then tell the evaluator my skill is done.
So you have to say step by step what you're doing.
Okay, so that's a very good question.
All right, so that's a very good question. The question is, do you have to say all of those steps out loud? And the answer is yeah, but not the way that I say them. You can say it the way you would say it. But remember that you had to come to class to learn how to be a CNA, right? You don't know the steps. I'm having to teach them to you. If you knew the steps, you wouldn't be here. Fair?
Fair.
Okay. Do you know who else doesn't know the steps? The patient. They didn't take a CNA class. They have no idea what you're doing. They're in a vulnerable position, barely dressed, in a strange place, and scared out of their minds. Do you really think you want to just kind of leave this up in the air? Because if you don't explain to them what you're doing with them, they're likely to resist or outright become combative because they see you as a threat. They don't know that you're just trying to help them. Does that make sense? Now, this is even more important with dementia patients. We're going to talk a little bit about dementia in an upcoming section. You've got to communicate them on their level. You got to somehow try to explain to them what you're doing. If you don't get them to understand what you're doing, they will react negatively. Not might, they will, because everything is a threat when you don't understand anything. Does that make sense? So yeah, you really should talk your skills out. Now, you don't have to say it exactly the way I say it. You don't have to say every single step. But there's another reason why you might want to talk your skills out for the state exam. You got 2 evaluators that are grading what you're doing, right? And they've got this checklist. And they are literally working off a physical checklist, just like this. So when you're doing your skill, they've got a wax pencil or a dry erase, and you do a step, they got to look down here and put a check mark. And you do a step, they got to look down here and put a check mark, and check mark, and check mark. Where is their attention? Here. If you do something and you're not saying it out loud, you just do it, they may not see it. Because where is their attention? Yeah. So you want to try to talk out your steps, because if they don't see it, at least they'll hear it and you'll get credit for it.
Keeps you honest.
Yeah, absolutely. Now, there's another reason why you want to talk out your steps. Have you ever watched a movie so often that you learned the lines? Right? For me, it's Top Gun. I can say every word of Top Gun. Love that movie.
I said mine's
Aladdin.
It's a musical. It doesn't count.
Yeah.
musical.
It is.
No, it's not. I'm talking about the cartoon.
It's a musical.
It's not a musical.
Okay.
I like musicals too, so that's all right. Okay, so if you've watched a movie so often that you've learned the lines, and you can kind of, if they stop talking, you could kind of finish what they were going to say, right? You now know it. I mean, you know it. Correct? If you watch my videos enough that you learn the lines, right? It will help you when you're performing the skill, because you'll say it before you do it, and it reminds you what to do. We've done a lot of observation of testing students. I mean, I've had over 5,000 people go through my class and test. I got a lot of data, guys, and I've talked to a lot of students, and I hear the same thing over and over. Miss Patty, I heard you in my head when I was testing, and I just said what you say, and I got a perfect score. Because hearing it in your head and then saying it will remind you to do it. Okay. Yeah, it is. It is. And it works. It works. So the answer to your question is yes, but you don't have to say every word I say. Okay. For a lot of reasons. All right. Good. Good. All right. So we're going to move on to page 102. This is our last skill for today. Look how far you've come. It's amazing. I am so proud of you guys. Hey, you came back after Monday. I'm really proud of you. Monday was horrible. Horrible. I hate feeling unprepared. I hate it. So thank you guys for putting your faith in me and coming back. I hope today was a little better. All right, so here we go. We're going to learn a new skill. And if you look down here, we have a lot of principles involved in this skill. We're going to follow the care plan. We're going to do our openings and evaluate if we need gloves, because we do that for every skill along with the closing. Remember, the big 4 are part of every skill. But for this skill, we also need barrier rules, right? We need a clean place to put our supplies. We need a privacy blanket, which we're going to talk about in just a minute. Linen rules, because we're going to be working with linens and we don't want to hold them where? Against our uniform. That's right. And then we've got some skill specific steps to talk about. So we've got a little bit to learn with this one, but we have a principle, and that's what we're going to start with. Our privacy blanket principle. Good. Dignity is essential. So is comfort. And we're going to think about this from the patient's point of view for just a second, because that's really what the privacy blanket is all about. So the first thing you need to understand is your perception of temperature is radically different from your patient's. And right now I can illustrate that right in this room, because your perception of the room temperature is different than mine. We're all in the same room. But you guys are sitting down. You're not active at all. The room probably feels cold to you, a little cooler, right? I don't have that problem. Why? That's right. I'm walking around. I'm more active. So what do you think the room temperature feels like to me? Yeah, warm. Absolutely. We are in the same place at the same time, and yet we do not perceive the temperature the same. Does that make sense? All right. So anybody ever been in a clinical setting? What's temperature feel like in there? Oh, yeah, it is cold. Now, you're not going to feel as cold. Now, you're going to feel cold, right? But you're not going to feel as cold because you're up running around. You're active. I mean, you got way more patients to take care of than you can possibly take care of. We are so short-staffed. It is unbelievable. I'm going to be talking to you about that on the last day of class. I'm going to try to get you to recruit. We are 1 million CNA short, guys. We're 1 million CNA short. And guess what? We got 1.3 million CNAs working. So if every CNA recruited just one person that they liked, that they thought would be a good CNA, and got them in class and certified and working with them, we are 4 weeks away from solving our CNA shortage. Can you imagine how wonderful it would be to go to work and not be short-staffed? You might actually like your job. And you have the power to fix it. All you guys need to do is recruit one person, right? So we'll talk about that a little bit more at the end of class. But when you are in a clinical setting and you're running 1 million miles a minute because there's way too much to do, it's going to feel warm to you. Now, the setting is already cold. You got a patient who is dressed in a hospital gown in a bed, not moving. What does temperature feel like to them? Yeah, like icy. Now, take their sheet away. Not only are they going to feel cold, but they're also going to feel exposed. There's something about laying down and having your knobby knees exposed. It really makes you feel vulnerable. It does. Now, you can stand up in shorts and be just fine, but you lay down and it makes you feel exposed. Isn't that weird? Right? Knees are not really a body part you would think about feeling exposed, but it's true.
I feel like it's now because it's at eye level.
Yeah, but it's true. Patients feel very exposed when they're in a bed in a hospital gown. If you take that sheet away, they're really going to feel very vulnerable, and they're probably going to feel a little threatened, right? But sometimes we have to take the sheet away to get our job done. I can't dress this person with a sheet on them. I got to get to their feet. I got to put socks on them and pants on them, and that sheet is in my way. So there's something else that we can do. The way that we solve this, hold on. I forgot. I got to tell you this part too. All right. So we're going to talk about privacy blanket in a minute, but let's talk about privacy as a general concept. We already know during the opening that we're going to pull that privacy curtain because we want to shield the patient from the view of everybody out there, right? Their roommates, people walking down the hallway, other caregivers, whatever. So a privacy curtain, back here, a privacy curtain does a good job at shielding the patient from everybody else, but it doesn't do a thing to shield the patient from us. And at the end of the day, we're still a stranger. We don't think about it that way, but your patient may, right? If we're undressing this patient and we are a stranger, they may feel some kind of way about that. So we want to try to minimize the exposure whenever possible. And we do that by adding an extra layer of protection against us. Good? Makes sense? So we are going to use a privacy blanket anytime for any skill where our patient is uncovered or undressed. So if we're doing range of motion on a patient and they're fully clothed, we don't need a privacy blanket because they're not uncovered and undressed. If we're doing mouth care on a patient and we have no need to pull the sheet down, the patient is not uncovered, so we don't need a privacy blanket. But if we're going to dress a patient and we have to pull that sheet down, now they're uncovered, so what do we need? Privacy blanket. So this is something you should know. It's not going to be on the care plan. There's no care plan in the world that's going to tell you to cover the patient with a privacy blanket. It's just a principle you need to know. It's called a basic nursing principle. That's what all of these things are. They're basic nursing principles. So using a privacy blanket ensures that the patient is always covered with something, whatever that something is. Sheet, blanket, whatever. It makes sure that they remain covered. But when you put the blanket on, over the patient, sorry guys at home, you can't see right now. When you put the blanket on over the patient, I don't want to pull the sheet all the way off the bed and then put the blanket on because then my patient was uncovered. So I'm going to put the blanket on over the sheet and then hold that blanket and pull the sheet down underneath so that when I do it this way, the patient remains covered throughout the process. Good? That detail actually matters. Okay, don't take the sheet all the way off the patient, then put the blanket on. You put the blanket on and then pull the sheet down underneath. At the end of the skill, when we're all done, we're going to reverse the process. We're not just going to take the blanket away. We're going to pull the sheet up over the blanket. And we'll pull the blanket out from underneath. Anything that we remove from the bed, you want to roll up in a ball. We don't want trailing edges to contaminate other surfaces. So anything that we remove, we always roll it up in a ball so we have control over it. Good? Okay. All right, so we already know this. Remember, if it's mentioned twice, it's super important so we don't snap or shake the blanket when we put it on. And then the next step is one that's going to trip you up. It always does. You don't want to touch that sheet with dirty hands, or I'm sorry, dirty gloves, because that sheet's going to go right up next to their face. So if you're wearing gloves, remember we wear gloves when we're around wet body openings, right? So things came out of the doors. They're on our gloves. We don't want to touch that sheet that's going to go right up to other doorways with those pathogen covered gloves. Does that make sense? So at the end of the skill, everybody always wants to take the blanket off right away. You can't. You got to put all of your dirty stuff away. You got to clean your basins. You got to take your gloves off. Once everything is clean, then you can take the blanket away. The blanket gets removed after you remove your gloves. Good? I know that one's tough. You'll forget that, and I'll remind you as we go through the program. That step is tough. It's tough to remember.
Does the blanket go up? The last blanket you take out goes in the hamper?
Right. Everything's going to go in the hamper. We're going to talk about that a little bit later on in the program. But yes, it would go directly in the hamper. Okay. Good. Questions? Okay, go to page 98. We'll talk about dressing basics. Again, I got a lesson on this, but let me talk you through it. All right, so everyone has a right to choose their own clothing. Well, that just makes sense. What you wear, unless you're wearing a work outfit that they dictate. Now, that's the exception to this. Other than a work outfit that they dictate, what you wear is usually a reflection of how you feel that day. There's some days I get up and I put on my bright yellow shirt because I'm in a sunny mood. And then there's other days that bright yellow shirt offends me because I am not in a bright yellow mood, right? So we choose our clothing based on the way we feel. Your patients have the right to do that as well. The way you dress is an outward reflection of how you feel internally. So we want to ask our patient, what do you want to wear today? And that's an important consideration. You have to make sure you ask on the test. But this is a mannequin skill. This is going to be done on a mannequin. How do you ask a mannequin, what do you want to wear today? Well, the evaluator is going to play the voice of the mannequin. So you're going to talk to the mannequin and you're going to get an answer. And one of the evaluators is going to tell you something on the shelf to get. Make sure that you get what they describe. That's going to be very, very important. When you're working with patients, though, patients have the right to choose their own clothing, but you are actually judged by how your patient looks. So if your patient asks for purple plaid pants and a yellow flowered shirt, and this does not go together, you can suggest an alternative. You can say, hey, your white shirt would go really nice with those pants. Did you want to try that? Now, if they are dead set on that yellow flowered shirt, no problem. I'll get that for you. But most of the time they'll go, yeah, that's what I meant. Okay. Some people never developed the ability to put an outfit together. Some people developed it and then lost it. Some people just don't really care. Right? But we are allowed to suggest an alternative, but ultimately we're going to honor their wishes. Whatever they want, we'll do. Now, clothing is going to go on a barrier on the table. Because remember, clothing is clean. The table is, not. So, do we go get the clothing first?
No.
What do we get? The barrier first, the chucks first. We're going to put the chucks on the table and then go get the clothing. Good? Super important you understand that order. You want to minimize exposure when you're dressing the patient. You don't want your patient to look like that. That's uncomfortable for everybody, right? We want to minimize exposure. So how do we minimize exposure? Well, we want to pull the privacy curtain. That's a no-brainer. We want to use a privacy blanket, which that we just learned about. But we're also going to go get the clothes before we undress the patient. If I don't point that out, you might not put that together. Okay? So we have to get our clothing before we undress the patient. Otherwise, your patient's laying there with no clothes on. And that's very vulnerable. Okay? Anytime we lift an extremity, we want to lift from below with a flat palm. We're going to talk about this a little bit more in an upcoming episode. And the stronger arm should do all the work. So we have an acronym. We're going to remember this. USA first. We can all remember that acronym, right? USA first. In this case, USA first means undress strong arm first. So if your patient has a weak arm, we want to undress the strong arm first and make it do all the work. Then we're going to dress that weak arm first. And the reason is that if we make the strong arm do all the work undressing, right, it pulls back in, it gets out of the sleeve, then the garment just slides right off that weak arm. No movement necessary. And then when we go to dress the patient, we're going to slide the new garment up the weak arm, no motion necessary, and make the stronger side, again, do all the work. So we remember that with USA first. Undress strong arm first. Okay, good. All right. So this just shows you what I just talked about. We're going to make the stronger arm do all the work, and that way the garment just slides off and then back on that weaker arm. Try not to cause injury. Don't overstretch, move things unnaturally. Just be careful with your patients. They're fragile. So remember that your care is judged by based on how your patients look. So at the end of the scale, make sure everything's snapped right, buttoned right, pulled up over their backside. Socks, the seam is over the toes, not all cattywampus, right? Make sure your patients look good. Yep. Now linens, don't leave them anywhere, nowhere. So in this case, we're going to have a patient gown that we're taking off of the patient. We're going to have a privacy blanket. We have to put them somewhere. We never put anything on the floor. Nothing goes on the floor. You don't want to leave it on the overbed table either, because at the end of the skill, our environment should be clean. So we're going to put these items in the hamper. We're going to talk more about hampers in an upcoming lesson. I'm not going to get into hampers today, but just know that these items will go directly in the hamper. Okay, at the end of the skill. Call light. Remember I told you on the closing, the call light needs to be in or near the hand, but there's two skills where we actually have to physically put it in the hand. This is one of them. So for this skill, your call light has to go in the stronger hand. We got to make sure they can use it. So we can't just lay it on the bed. Here you go. You have to put it in the mannequin's hand. And remember, this is a mannequin. Okay. So here's our care plan. Page 103. At the top of the skill here, or at the top of the page, sorry, it has our care plan. Dress the resident in a long sleeve, button front or snap front shirt, pants, and socks. Patient is lying in bed and has a weak right arm. So we know immediately which arm is weak. So undress strong arm first, dress weak arm first. It says the resident is not able to help with dressing, and after dressing, leave the resident in bed. Let's go back up here real quick. It says long sleeve. Let's stop there. Anybody been outside lately? Oh my gosh, it's horrible hot. Horrible hot. You might read that and go, that nurse is nuts. I'm not putting long sleeves on this patient. It's hot. Understand long sleeves are often used for things other than temperature. If your patient has an autoimmune disorder, a lot of autoimmune disorders are triggered or worsened with UV light exposure. So when a patient has an autoimmune disorder, a lot of times we will make sure they have long sleeves and long pants on, even if it's 100 degrees outside. Patients that have weepy rashes, we want to protect all that gunk from getting on other patients and chairs and things like that. So long sleeves might be ordered. And there are some medications that make patients photosensitive. That means that their skin could react to sunlight. This actually happened to me when I was 18 years old. I didn't, 18. You think you know stuff, you don't know anything. So I was on an antibiotic, went to the pharmacy, picked up my antibiotic, and it had that little sticker on it, says avoid direct sunlight. And I ignored the sticker because who cares, right? I'm 18. And I went to Daytona for the weekend. And I was out in the sun, and we came in. It was me and my best friend. And she looked at me and she goes, "Oh, you are purple."
What?
Now I burn. I mean, I will end up looking like your uniform in, 20 minutes in the sun. I burn, but no, I was purple. I mean, like legitimately purple. The capillaries under my skin burst. Yeah. I can't take that antibiotic anymore because it reacts with me. So those little labels that say avoid direct sunlight, that actually means something? Who knew, right? Who knew?
That's crazy.
Yeah. So when we have situations where our care plan is making a very specific request of us, there's a reason behind that. We may not know it. We may not understand it. We don't need to. What do we need to know how to do? Yeah, follow the care plan. Absolutely. Does that make sense? Okay. Now, it also says button front or snap front shirt. Let me explain that real quick. Our patient has a weak arm. Most of us get dressed, we put on clothing that goes over our head, pullovers. Almost everything in your closet is probably a pullover, but that requires that your arms are able to stretch. If you have a weak arm, that can be a problem. So when we have patients that have a weak arm or an affected shoulder, we tell the families or the patient, go get button front shirts. Anything that fastens up the front, button, snap, don't care. Because it's easier to dress side to side than it is top down when you have limited mobility. That's why this care plan says what it says. Now, notice this care plan does not say anything about undergarments. We follow the care plan, the whole care plan, and do we care about undergarments? Nope. Doesn't say we have to put them on. We don't care. Not our job. We're following that care plan. Okay, good. Now, if your patient needs a bra, you may have to help her with that. If she needs undies, you may have to help her with that. This patient doesn't need that because it's not on the care plan. Good? Questions? Easy peasy? Hold on, guys. We're almost there. All right. So just to review all of our important steps, I'm going to show you this skill. We're going to ask about clothing preference. What do you want to wear? We're going to get the clothing before we undress our patient. We'll support all joints when we lift. We're going to undress the strong arm first, USA first. We're going to gather the sleeve and dress the weak arm first. Remember, we want to limit motion whenever possible. We don't want to overextend or force movement. We're going to adjust clothing so that they're nice and neat when we leave them. Put all dirty items in the hamper and the call light in the stronger hand. So now that you know all of those important points and you know all of the principles involved, I'm going to show you the video and we're going to put it all together. Okay?
Hello, Mrs. Jones. My name is Patty. I'm your CNA today. How are you? Good. I'm here to help you get dressed. Is that okay? Okay, I'm going to close your curtain. Let me go wash my hands, get my supplies, and I'll be right back. The first thing that I'll get is a barrier to put on my table to make sure that my supplies remain clean. Mrs. Jones, what would you like to wear today? Your light pink pants and dark pink shirt? Okay. Is this the outfit that you described? Wonderful. I'll get a privacy blanket as well. Okay, Mrs. Jones, I'm going to spread this privacy blanket out over you. This will keep you warm and help protect your privacy as we do this skill. I'm going to carefully unfold the blanket, being careful not to snap or shake it as I lay it out over you. Once the blanket's in place, I'll pull your sheet down to the end of the bed. Okay, Mrs. Jones, I'm going to place your socks on now. We'll take one of the socks, scrunch it all the way up to the toe seam, put it over the foot, making sure the toe seam is lined up, lift from below and support at the ankle, and smooth the sock over the heel. Now we'll go to the other side. We'll scrunch this sock up, put it over the foot, making sure the toe seam is lined up, lift from below and support at the ankle, and smooth the sock over the heel, minimizing wrinkles. Now we'll help you put your pants on. We're going to make sure the tag is in the back. I'm going to insert one of my arms into the legs of the pants and scrunch it up so I have control over all the material. We'll then place it over your foot, lift from below, and smooth it over your heel. We're going to repeat on this side. I'm going to put my hand inside to scrunch up the leg of the pants, and then place it over your foot, lifting from below and supporting at the heel while we finish putting on your pants. Okay, Mrs. Jones. Now I'm going to lift your pants up over your hips. If I can have you raise up your hips as high as you can on the count of 3. 1, 2, 3.
She's a mannequin.
I'll make sure that your pants are over your hips and then cover you back up. Okay, Mrs. Jones, I'm going to elevate the head of the bed now. Please tell me when you're comfortable. And if I can assist you to lean forward, I'll untie your gown. Thank you. I'm going to tuck a corner of the blanket behind your back as you sit back. And now I'll remove the gown from this side. We're going to undress the strong arm first. Since our care plan indicated your right arm is weak, we'll undress your left arm first. I'm going to the other side of the bed now. Okay, Mrs. Jones, I'm going to undress this arm. Being careful to minimize the movement and support the arm at the elbow as I lift it off the bed. We'll remove the soiled gown. We'll go ahead and rest your arm back on the bed. Okay, now I'm going to assist you with your shirt. I'm going to scrunch up the arm of the sleeve and put my hand through backwards, keeping your arm supported on the bed. I'm going to lift your hand and hold it as if we're shaking hands. This will keep all your fingers together as we place the sleeve over my hand and then over yours. Once we have the sleeve in place on your arm, we'll extend your arm out. I'll support at the elbow as I bring the sleeve the rest of the way along your arm. If I can have you sit forward, Miss Jones, let me assist you. Thank you. Make sure that you remain covered and smooth the shirt along your back. Come on back, Mrs. Jones. Thank you. Okay, Mrs. Jones, I'm going to assist you in putting your other arm in your sleeve. So I'll scrunch it up, put my hand in through backwards. And Miss Jones, if I could have you reach your arm up and back for me. I'll assist you to put your arm in the sleeve. Okay, Miss Jones, we'll rest your arm back on the bed now while I straighten your shirt and make sure that it is snapped appropriately. Okay, let me just adjust your clothing to make sure it's neat. Can I have you lean forward for me, please? Thank you. And I'll make sure that this blanket can be removed. Okay, Ms. Jones, I'm just going to gather up your privacy blanket and place it in soiled linen along with your gown. I'll be right back. Okay, Mrs. Jones, I'm just going to adjust your clothing for neatness and appearance and make sure that it's fastened appropriately and that you look good. Very nice. Okay, you have your call light here if you should need anything. Can I get a magazine for you? Okay, I'm just going to throw your barrier away and open your privacy curtain. Now we'll go wash my hands. After washing my hands, I'll think about the steps of my skill, make any corrections, and then tell the evaluator my skill is done. Okay. Take one and pass it around, please. All right, that's your review sheet for today. Remember your homework. You're going to read 2 chapters tonight. If you thought one was bad, you're going to read chapters 2 and 3. They're very long. Try to read in short segments, 10, 15 minutes, and then go do something else. Otherwise, your brain won't take it all in. And then you want to take the tests, of course, and grade them. Make sure you open up the wrap-up email to view the links and complete the lessons in the online course if you want. I'll see you on Monday at 9 a.m. Does anybody have any questions? Is everybody happy with how class is going? Is anybody lost? Am I going too fast?
I do have a question. So what if the resident won't do what you tell them to do?
Okay, so anytime the patient refuses, we tell the nurse.
All right.
That's it.
I
That's
was
it.
told the resident has the right to refuse.
Absolutely. They do have the right to refuse.
All right. So
We're gonna talk about that in upcoming, we're gonna talk about that. But yes, the patient has the right to say no. No means no. So we're just going, try to find out why though, because when you go to the nurse and you say they won't let me do whatever, the nurse is probably gonna ask why.
A lot of the times, you guys be surprised how many times you'll go to the nurse and the nurse will be like, "Oh, let me go," and try to convince them or something,
Right,
and then
they let you after
they let
that,
you after that. But sometimes they don't.
Yep. Try to have some fun this weekend, guys. We did learn some skills. You can practice them. Bring your blood pressure cuffs and stethoscopes to class with you on Monday. And if you have any problems or any questions, I am still here after class. Those of you joining us from YouTube World, remember I go live tomorrow at 3 p.m. from St. Augustine. I'll have a good lesson for you, so tune in. And the game show is on Tuesday. So you can join us for the game show on Tuesday as well. Until next time, guys, happy caregiving. Bye.
We're reading chapters 2 to 3, or
2 and 3, yes.
Do we need to
And
bring
then-
something to track the blood pressure?
If you have like a something round like a Lysol can
Something
or
arm shaped?
something about the size of a human arm that won't collapse, like water bottles collapse, we don't want to use those.
So do you.
Yes, please. All right, YouTube world. See you next time. Bye.
Have a good time this weekend.
Thank you.